Sir, is this a question to me? Hello? Is this a question to...
Mrigana
I didn't get...
Bhargav Saikia.
Yes, sir. So I'm actually an offline student.
Okay. Were you here the last 3 days for this course?
Yes, sir. Yes, sir.
And were you okay? So today you are doing online.
Yes, sir.
Okay. Problem driver pointer system. Yes, give me 2-3 minutes. When we start, I want to make sure the people online will also benefit. I will wait 2 more minutes. Shashi, yesterday you wore pink, so I wore pink today thinking we'll match, and you changed. We'll see. Shh, don't tell others. These people all, they wore blue, didn't tell us. Okay, I'm going to start the session now. So, welcome back. Good morning. This is day 4 of our GIAN program related to road safety, data and emerging technologies. So, I had a question here from Ritvik to remind the audience, the participants, of the problem driver notification system, right? Pointer system, yes. It is basically a centralized coordinated. I have a web link in my slides that will give you more information. It is basically a system, record keeping database system managed centrally in the United States by the National Highway Traffic Safety Administration, often known as NHTSA, NHTSA. These are to help each state manages their own driver's license information. So, this is a central database to help identify repeat violators, or let us say I got a license in state 1 and then I moved to another state and I want to get my license there. Do I have a history in state 1 so state 2 can look at it? For the commercial motor vehicle drivers, there is yet another one to look at it. So, that is a quick overview of what that is. It is a centralized database to identify high risk or repeat violators. And this is based upon the points or the citations, challans that they receive. There can be more done. For example, tying up with the insurance industry, who have much better information, but they are private. They seldom share their data, as I mentioned, because of the competitive things. The one other, okay, talking about insurance companies, data that I haven't talked about, but emerging data in the last 10 plus years, maybe 15 years, many insurance companies have initiated programs for people who they insure, saying that if you opt into a particular system, we will monitor your driving, and if you are a good driver, you will get a discount. So, in olden days, it used to be olden days many years ago, they will give you a device that you mount in your vehicle. It basically captures these following critical data and several others: time, location, speed, acceleration, and abrupt accelerations, abrupt decelerations, both longitudinal and transverse. So that is their way. They collect that data to analyze individual drivers about their driving profiles, and collectively many drivers, if they cover in a metro area or urban area, are there things related to certain areas where they have higher risk. So if you are there, maybe your premium will go up. Nowadays you don't need to have that physical device, you just download an app and it runs on your mobile phone. They can capture the same information. So the insurance industry has a tremendous amount of data that are valuable for our safety analysis. So unless you have a specific project that is funded by the insurance industry that is of interest to them, it's unlikely that we will get that level of detail on the data. So today's sessions, morning and afternoon, and so the slide deck that I have here has 68 slides, so it's much longer than the others. I don't anticipate going through all of that in the morning and the afternoon, so it is to combine, and then it will lead into the session tomorrow, if depending on how much progress we make today. I will address some of these topics that I would have otherwise covered or touched upon tomorrow. I will do that today. Any questions, comments, feedback from the participants? Ritvik, were you able to get the survey results?
Yes, I shared you the link.
In was that email or how did you share it?
On WhatsApp.
Okay, that's the problem. I didn't look at the WhatsApp. Okay, I'm sorry. Yeah. Okay, I will see when I get a break. We'll see. Any other comments, feedback? All right. So as always, I try to outline what we should try to get out of this session, this afternoon session, and a little bit into tomorrow morning session. We've talked about many ways, many sources of data. We've talked about some indicators of data of safety, such as crashes, fatalities, injuries, the CAPCO scale. Excuse me, but there is more. So we'll get a little more about that. And we've already addressed some of the critical factors, but how do they tie to some of the things that we're going to address today? What are some ways to model or analyze the data? I'm not going to get into details of mathematical modeling. I will just try to give you a feel for what are the types of approaches. That will be later today or early tomorrow. But and issues related to data integration, we've seen several things. You've tried to work with one data set. In today's tutorial, I'll add a second data set which relates to fatal crashes, only fatal crashes, but there's a lot more detail compared to what we've seen over the last 2 days in our tutorials. And how do you tie all of these together to come up with a basic safety analysis framework for safety analysis? I mentioned in my discussions that traffic crashes are the leading cause of preventable deaths in the United States, and I wanted to show you the actual data. This is from a health agency. So what you see here, preventable deaths are less than 2 years of age, less than 1 year of age, and all the way up to the age 44. Traffic related unintentional injury, which is essentially traffic, is the leading cause. So the top you have columns for ages, and the rows are the rank, how high, and this is based upon 2021 data. So you see all the way from 1 to 4, 5 to 9, so on, up to 35 to 44, traffic crashes are the leading cause. Then in 2021 when they reported it, this went down to rank 4, even though the number of fatalities dropped just a little, 36,000 to 31,000. That's a 5,000 drop, which is substantial. But why did it go to rank 4? Because of COVID and COVID related. COVID became the first, and because of COVID, number 2 and number 3 got exacerbated because of complications related to COVID. So otherwise, even for age 45 to 54 and 55 to 64, all the way. So from age 1 to 65 or so, traffic related causes are the leading preventable death. And in the United States, just so that you know why 65, most organizations allow people to work at least until the age of 65, if not longer. So, people are driving are very active. And for older ages, traffic goes down, the exposure is much lesser. Driving, they don't drive as much compared to when they were working or when they have families driving their children around, so on and so forth. So, this is something I wanted to touch upon. The other thing that I wanted to talk about, how many of you have not heard about the Hayden's matrix? If you have not heard about the Hayden's matrix, oh wow. Online, if you have not heard about the Hayden's matrix, please raise your hand. Okay, Aishwarya, I saw you briefly raise your hand. Pratyush, okay, there are a few. Basically, this came about 50 years ago, more than 50 years ago. Is if you look at the matrix, you have columns which are pre-crash, during the crash, and post-crash, and on the rows are human factors or travelers. This basically user behavior. Second is vehicle and equipment. Third is road and environment. I apologize for these not lining up. When I changed the format for the slides, it just got skewed a little. This is what Professor Maurya was telling, some things may get, but you know that these are the 3 rows. But what we can do essentially as traffic engineers for the most part is looking at pre-crash and road and environment. During crash, how do we design the roadside hazards or safety clear zones? And if the goal is vision 0, what we need to focus on is pre-crash. What can we do to avoid a crash? So, Hayden, Mr. Hayden worked for the Insurance Institute for Highway Safety in the United States. That's an institute that is funded by many insurance companies. They look at their interest to look at. So, if you look here, there are things related to road design, road operations, road maintenance, and delineation. So, these are all design related pre-crash that an engineer does. We don't have much control over weather conditions, but we can design the roads. If there is a place in northeast you have a lot of rain, make sure that the pavement is designed so that you drain the water off of the roadway surface. But in terms of other pre-crash, where we can have a difference is the human factors of travelers. We've talked about attitudes, driving under the influence of drugs or alcohol. We didn't talk much about driver skills or vision, but those are critical. That's why they make you go through a driving test, a skill test, to demonstrate that you can safely operate the vehicle. Vision, they make you do an eye test to look at that. And vision is tied to totally unrelated to what we have talked about. I won't touch upon it much. How do we decide on the sign, colors of the signs, the contrast of the signs, the sizes of the signs, lighting, so on. So, all of that has to do with vision. And there is a good number of road users of the population who are colorblind. So, they may not be able to differentiate between blue and green. So, we want to make sure that the colors that we use, black on yellow background, black on white background, these are very clear contrast. So, this is something, those of you, if you have an interest in safety, please look it up. There are lots and lots of references to it, but there are some summaries that you will be able to read in about 15 minutes to 30 minutes that will better inform you. But the point is, we also need to work with the mechanical engineers and others who do the vehicle design, vehicle size, and we take into account the impacts of vehicle statics, vehicle kinematics, whether it is traffic signal design, roadway design, curvature, width of lanes, shoulders, parking, so on and so forth. So, there are a lot of interdependencies. This is, I gave you the conceptual schematic figure yesterday, then I gave you another one which said 10 to the power of 12, 10 to the power of 8, 10 to the power of 6. These are actual data from 2015 and 2022. So, if you look at the bottom of the pyramid, there were about 13 million crashes. About 1/2, 50% were police reported, which means there are 50% even in the United States that are not reported. So, that is why this is an estimate. And of these 6.3 million, 4.6 million, so about 75% were just property damage, 1.7 million were injury crashes, and then you have this includes the A, B, C, and the fatal crashes there were 32,000. 32,000 crashes, but more fatalities because there may be multiple fatalities per crash. And if I look at the 2022 data, then this pyramid is for 2015, 22 data was slightly lower, but overall the societal harm, when we talk about billions of dollars, people are not able to get a sense for what does it mean. I am just going to use rough numbers here, $240 billion economic costs. The US population is approximately 330 million. So what does it cost per person? 240 billion divided by 330, or 240 divided by 0.3. That's per person per year. So that's just the economic. If I use the societal harm, it is 3 times that, 3.5 times that. So you're looking at tens of thousands of dollars per person due to adverse safety outcomes. So this is something I wanted to recap what we talked about in the last few days. So here's a quick assignment, team assignment. Ritesh, you need to come sit with Shashi. I'm going to make you move forward as opposed to have Shashi go back. Those of you who are online, please connect with your WhatsApp groups. I know Ritvik sent a message yesterday. I don't follow the WhatsApp group when I'm in class. You were in group 1, right? Yeah. So Ritvik was participating with the WhatsApp group 1 when he was online day 1 and day 2. He's here in person, so he will not be participating with group 1. So all of you, it's a very simple problem. I'll give you 30 seconds. There are 2 districts that we are analyzing, wherever it be, whichever state. One district had a total of 1,000 crashes, the other district had a total of 1,020 crashes. Which of the 2 is safer and why? I'm going to give you 30 seconds starting now. Talk to your neighbors. Five seconds to go. Okay, time. WhatsApp group 3, what did your group come up with? Which is safer? Group 3? Nobody speaking up. Okay, WhatsApp group 4? Come on, people. WhatsApp group 5?
So just looking
Yeah.
at the number of crashes, it is very difficult to comment on that.
Yeah, this is the only information you have. You are a district collector, you were talking to the people, the population, people are complaining there are too many crashes, it's not safe. The superintendent of police, DSP, comes up and says, sir or madam, here are the total crash numbers. So that's all the decision maker had at this point of time. So I know you said it is difficult, but which is safer based on the data you have?
So based on just the data, A is safer.
A is safer. Okay. WhatsApp group 5, that was group 4, right, Pratyush?
Yeah, sir.
Group 5? WhatsApp
I
group,
think,
yeah.
hello sir. Good morning, Chandrika here, sir.
Yeah.
Total 1,000 crashes. I think it's lower, so
It is
because
better.
we don't have another.
Okay, smaller
Yeah.
number is better. Okay, thank you. WhatsApp group 1? Okay, WhatsApp group 2?
Hello, sir.
Yes.
Sir, option B is safer, sir.
Option B is safer, even though it had more crashes.
Yes.
Okay. What makes you say that?
Bottom group 3, sir.
So maybe when we divide by the population, maybe
No, I didn't give
considering
you
the-
anything. The 2 districts have about the same population, same number of lane miles, lane kilometers, traffic volume. Everything else is approximately the same for the 2 districts. The only difference, significant difference, is the number of crashes.
Okay.
Sir,
Then maybe
divided by 365 and divided by 5 years.
Okay, that is all right. That will give you per day. My question is very simple. Which is safer?
10202.
1020 is safer. Okay, that's how I crashed. All right. WhatsApp group 2. Was that group 2? I think group 1 did not
Yes, a
respond.
group 2 just now.
Yeah. All right. In here, so I see, I want the two of you to sit together. Asagri, what did your team come up with?
If this is the only metric, then A is
better? Okay.
Safe.
All right. Ritesh, what did your team come up with?
Sir, I think none of them is safer. Both are disastrous.
Okay, one life is one too many. Okay. Sayantan?
Yeah, sir, in our opinion, that's the same because no one is safer because it has 1000, it has 1020, only 20 is the difference.
Okay.
So nothing is safer.
Aapka team.
We believe from these numbers A is safer, but so the thing is, unless until we classify them into Cabo scale we talk about,
Okay, so
Then
A is
only we
safer. All right.
then only we can decide.
All right. Pratyush, you also said that you needed more information. What information do you need, Pratyush?
Firstly, the severity of the crashes, like the crash can happen in anywhere. The severity of the crashes, the population, the
Okay, so
kilometers traveled in those things.
I understand. Okay. I knew you would ask this question. So, everything is the same in these two districts. The population is almost identical. The age distribution of the population is almost identical. The gender distribution of the population is almost identical. All right. The travel demand, the supply are all identical. The only difference is what I am just showing you. The same number that I showed you on the previous slide, I am giving you a breakdown on the Capco scale. Now, I will give you 1 minute for your teams to discuss and tell me which one you think is safer and why. Starting now. Tell me your names again. Anuj? Rizul, yeah, I remember. All right, 5 seconds. Okay, time. Anuj and Rizul, what did your team come up with? Be very brief. I don't need a long essay. In 10 seconds, tell us.
District 2.
District 2 is safer. Why?
So because the major injuries is less.
Major injuries is less. Okay, which specific number are you looking at?
A.
A, 36 and 19. Okay. All right. Ritvik? A, B, C are different types of injuries. A being the most serious, life changing. B is moderate. C is minor. O is property damage.
I choose to live in district 2.
You choose to live in district 2. Okay.
District 2 is safe, sir.
Safer?
Yes.
All right. How about you folks?
So actually we have different kind of thoughts. In his thoughts that district 2 is safer because there is a total number of injuries lesser than district 1. But sir, in my opinion, sir, district 1 is safer because sir, there is a less death. Because
Okay,
for us,
all right.
yeah.
I understand. But when you go to the district collector, you cannot say this to the district collector. You just need to say this is a collective decision. You are the engineers or you are the leaders. You have to come up with one. So if you cannot agree, arm wrestling. You say who wins and you go with that. No, you have to come up with. So online, does anybody have a different answer? Here I see several people saying district 2 is safer. Anybody online have a different answer?
Yes, sir.
Okay.
So district A has less fatal crashes
Okay.
compared to district B. Yeah.
Okay.
So that's why group A is safer.
Okay. So
Might be injuries be there, but life loss is less here compared to second district.
okay, thank you, Shekhar. So I want to be clear that these are not number of crashes, these are the outcomes. So 5 is 5 fatalities, not 5 crashes. 6 is 6 fatalities, not 6 crashes. All right, so I see now district 1 has 1 person championing for that. Anybody else? So from a safety perspective, it looks like we have a mixed bag. Fatalities wise, district 1 is better, but major injuries wise and medium injuries wise, district 2 is better. Right. Total crashes wise, district 1 is better. So from a safety perspective, there are things, but every time you have a crash, we have secondary impacts such as delays to traffic, so on. We haven't accounted for that, and in my discussions I am not going to account. So more number of crashes, you have more disruption to traffic. Okay. I will get back to this a little later. So the way that we have talked about safety so far this week has been primarily based upon the frequency or the count of the number of crashes. It could be per day, per week, per month, per year. We have looked at outcomes of crashes, fatalities, injuries, property damage, and the Capco scale. And then we also looked at, okay, who is involved, pedestrians, bicyclists, two-wheelers, buses, cars, trucks, so on and so forth. But all of this is based on either a count, or in this particular case, like I mentioned yesterday, look at percentages also, what share of the total. That doesn't tell the whole story. What we need to look at is some measures of activity or exposure. Just picture this. You have two scenarios. Scenario A, where you have 10 crashes. I am not going to say what type of crashes, just 10 crash outcomes. The same indicator in the other district is 20. Initially looking at it, 20 is worse than 10 because higher number of crashes or crash outcomes is worse. But like several of you said, hey, we need to know what the population is, or what the other better indicators are, how many vehicle kilometers of travel. District A had 10 crashes for let us say 1 lakh trips. District B had 20, but for 10 lakh trips. So you have 20 divided by 10 lakhs versus 10 divided by 1 lakh. So 10 divided by 1 lakh is a larger number than 20 divided by 10 lakhs, right? So when we normalize for exposure or measure of activity, in many cases we are not able to get actual vehicle kilometers of travel or vehicle miles of travel. For roadway sections or for areas such as a district estate, that is more appropriate. So what we tend to do is we likely will use other surrogate indicators such as per population, on average, or per vehicle. On average, every vehicle will travel 10,000 kilometers per year, a personal automobile. I don't know what the number is. Akhilesh, do you know what the number is in India? An average kilometers traveled by a car in India? 10,000, 12,000? Yeah, something in that order of magnitude. It's not 1,000, it is not 1 lakh. I don't think it is even 20,000 unless somebody is driving long distance every day. For typical urban driving, it would be somewhere between 10,000 and 15,000. Less than that. So I will use just 10,000 as a rough number. So if we can look at it by per registered vehicle, we can get a measure of exposure even though we don't have vehicle kilometers of travel. If all vehicles travel about the same, if we have a number of vehicles, that is a good indicator. Others include population. So the typically number of vehicles per capita is fairly stable over large area. 12 to 15,000. Okay, thank you. So per capita is yet another indicator. We saw that in the first class around the world, what are the outcomes, because some places you don't even have good indicators of the number of registered vehicles. A lot of people who have their own ways of devising mechanical transport means. So, but these are all reactive, not proactive. We are looking historically, what happened, what were the outcomes. If we want to prevent crashes, yes, we can learn from that, but we also need to look at near misses, near collisions, so on, and try to avoid that. So, some of the surrogate safety measures include at intersections. These are particularly time to collision. If two vehicles had conflicting trajectories, unless you alert one or both, how much time to collision and how much in advance of that. So, that is somewhat some of the advancements in the vehicle to vehicle, connected vehicle technologies, vehicle to infrastructure systems. Post encroachment collision time, time between when one vehicle leaves a spot and the next vehicle comes in. So, somebody either stopped or sped up just to avoid that. So, how close, how tight, how close a shave was that. Once again, these are typically at intersections. Deceleration rates, not the normal deceleration rates. For typical analysis for when you are looking at braking distance, we look at 11.2 feet per second square. I am using feet per second square, about 1.3 G approximately. For emergency braking, we may go to 0.45 or 0.5 G acceleration due to gravity. So, these are normal, but can we then, based upon the sensors we have talked about, whether in vehicle sensor technologies or our mobile phones and so on, discern if anybody is braking at more than 0.5 G, we will call it an extreme event. If they are braking at more than 7 G, one level higher. So, we can get those data. So, we can look at it by individual, which is what the insurance companies do, or we can do it collectively for a region, for a roadway, for an intersection, to see discern, are there problems with the roadway design, with the signal timing, traffic control, or is it just user behavior there to come up with the appropriate intervention. Proportion of stopping distance ratio available to where are people actually stopping versus what you thought you had. So, this comes with side distance, traffic signal timing, how much time are you going to give for your amber. So, these are far more proactive and trying to look at events as they happen. They did not end up in a crash, but could have happened in a crash. So, what can we do proactively to address this? So, here are several things on this slide, and I will go over the figure in just a minute. Let us just look at the items that I have enumerated there. So, measures of risk or exposure include traffic volume at intersections. It is not vehicle miles of travel that may matter. How many people are actually traversing the intersection, crossing the intersection. Motor vehicles, bicyclists, pedestrians, motorcycles, trucks, so on and so forth. Density, vehicles in a given unit of space. Congestion level, this is more on corridors, volume to capacity ratio, or the actual operating speed divided by the posted speed limit. If you have very heavy congestion, the operating speed is going to be much smaller than the posted speed limit. If you have very low levels of congestion, the operating speed may likely be even higher than the posted speed limit. Behavioral risk, speeding, distracted driving. So, one of the advantages, and I will show you tomorrow, is some of the vendors that I have been interacting with in the last 2 years use mobile phone technologies to discern a lot of things that I've mentioned in the last 2 days, including abrupt braking, lateral longitudinal acceleration, deceleration, but they are also able to discern, is somebody using a mobile phone when they are traveling? Not just that, is that person the operator of the vehicle versus a passenger in the vehicle? Is that person actually holding the phone in their hand or using Bluetooth? Are they actually looking at the phone, and if so, for how long at a time, and what is the longest glance, what is the average glance? So, all that comes to the distracted driving. So, they are able to discern that with the technologies that are available. Then we also have in vehicle cameras that I mentioned yesterday, where original equipment manufacturers, OEMs, install that to provide feedback to the user saying, hey, eyes on the road, or looks like you're fatigued, your eyes are drooping. They do that, but they also collect it for their own analysis. Infrastructure is roadway geometric design, road conditions, traffic signals, signs. Professor Maurya showed several examples of chevrons, for example. Do we have the right amount, right places, right visibility, so on. Weather related is harder for us to control, but if we know that, can we communicate that to the road users in advance, particularly motorized road users? Maybe even 200 meters upstream is enough. If you have, in US we have lots of icy, snowy conditions. If there's a slick patch of ice, can they alert other motors saying, hey, slow down, there's something. Fog, which I believe you have plenty of fog issues here in the Northeast. So these are some examples. The chart on the right is a different way of communicating what I did yesterday. I showed you the likelihood of survival or likelihood of death of impact at various speeds, 30 kilometers an hour, 60 kilometers an hour, 90. Here what I have is on the x-axis is speed in kilometers per hour, and on the y-axis is probability of death. But we have three lines. The orange is pedestrian, the blue is a pedestrian or cyclist collision, the blue is motor vehicle to motor vehicle side impact, and the red, I'm sorry, this is pedestrian, this is side impact collision, and this is head on collision. So for the same speed, so if I want to look at a 10% likelihood of fatality, the pedestrian fatalities occur at 30 kilometers an hour, side impact at 50 kilometers an hour, or head on at 70 kilometers an hour. You could change it around and say, okay, for a particular speed, what is the likelihood of fatality at 50 kilometers an hour? Head on collisions is very low out here, whereas for bicycle side impact it is 10%, whereas for a pedestrian it's 90%. So there are different ways to come. Now I'll give you several next several slides are just data from the United States. These are not number of fatalities. Remember yesterday towards the end I said we need to look at proportions. So what we have here are on the x-axis dates going back to 1975 through 2022, and on the y-axis is percentage. The black line is the number of people or percent of people outside a vehicle who were killed. The green line is people inside a vehicle. So the outside vehicle are motorists, bicyclists, pedestrians, and not occupants of vehicles. So you see that it has been stable around 20 to 29% around here. But in the last 15 years, what we are seeing is non-occupants of vehicles account for a higher proportion of the fatalities in the United States. There are many reasons. There are people trying to understand this. If you look at the literature, there are hundreds of citations that you can find. Here is crashes by severity. Once again, I'm just giving numbers, not rates. So here are data for 2021 and 2022. It's a busy slide. I'm not going to read everything. I want you to understand the structure and the essence of it. The first column is description: occupants of passenger vehicles, light trucks, SUVs, pickup trucks, so on and so forth, motorcyclists, and pedestrians and bicyclists. The first set of columns is killed, 2021, 2022 percent, the change, actual numerical change and percent change. The second set of columns, the same for the 2 years, the numbers injured, the actual change in numbers, and percent change. So what you have is total occupants killed in 21 were occupants were 28,000 and non-occupants were 8,800 approximately. And within occupants you have in passenger vehicles there were 26,000, of which cars were 13,000, trucks were 12,000, so on and so forth. We can slice it and dice it. And here the changes are numbers. In between these 2 years there was a reduction of 716, which is 1.7%. Same way the injuries reduction of 1,15,000 or 4.5%. And we can look at who is getting it. Give me one. One big change is non-occupants we are seeing increases. Yes, Ritvik? Yeah. So don't just go by the gross numbers, the total numbers, aggregate numbers. Try to get an understanding of who or what are contributing to the total numbers. Yes. No, even injuries are reported. Usually if there is a crash in the United States, the operator of the motor vehicle is required to stop and report it, make a call, or somebody else makes a call and wait until the police arrive. Okay. And in urban areas it is very clear during the daylight hours. There are others who will at least stop, even there are some hit and run cases. Rural areas it is harder, but rural areas we have much lesser pedestrian activity outside of some small conclaves. Bicycle activities, maybe people will ride in rural roads for a few kilometers, a few miles, but you are not looking at tens of miles. Very, very, very few people ride a bicycle more than 10 kilometers or so. Motorcycling in the United States is very small, and increasingly what we are seeing is over the last 20 plus years, since 2000, the age group of 40 to 65 are the heavier motorcycle, and they are recreational riders. They are not riding it to go to work or to go to the store or to, they just maza hai, so I want to ride. Weekend warriors, that's one of the terms. I digress. So this one gives you for 10 years 2013 to 2022 crash severity, number of fatal, number of injury, number of property damage, and total number of crashes. This is the numbers that are at the bottom of the pyramid I showed you earlier in today's. So what you are seeing, it went up from 30,000 to 39,000. It seems to have stabilized 21, 22 in total number of fatal crashes, but fatalities will see in a number. Injury crashes seems to have reduced. There are some COVID implications in the years 2020, 2021 for sure that has disrupted travel patterns. So this is number of crashes, and in the exercise that I gave you earlier today, you want to know not just crashes but outcomes by severity. So number of people killed. So that's this column. The next column is the population of the United States in each of these years, and the next column is fatality rate per population. So that has gone up from 10.41, went up to 13 in 2021, came down to 12.6. Fatality rate per number of per 100,000 licensed drivers, per 1 lakh licensed drivers, because you have fewer licensed drivers than you have the population. About 65% of the US population is licensed. Others are either too young, or some after the age of 70 or 75 they voluntarily give up, and there are a group of people who may be denied their driving license because of medical conditions, and there are others we talked about, repeat violators whose licenses. So that's why these numbers are about, this is about 65% of. So you see the rate per 100,000 drivers is been going up. The last year there was an anomaly. Per registered motor vehicle, so we have 303 million registered vehicles for a population of 333, and a vast majority of these registered vehicles are four-wheelers or trucks or lorries. So those numbers are here, and ultimately what I think is a much better indicator, we need to break it down as fatalities that occur within the vicinity of an intersection and fatalities that occur away from an intersection. For those that are away from an intersection or on roadway stretches, the crash rate per million vehicle miles of travel or 100 million vehicle miles of travel is a better indicator of exposure. How much are people driving, not how many people are driving. The extent, how many kilometers, how many miles are they driving is more important. So there you see the numbers from 1.1 has been steadily increasing, and these are much higher than the Western other westernized countries. Ritvik, did you have a question? Speak up please so the audience can hear too.
So can you please explain the VMT?
Vehicle mile of travel. I'll explain. if one vehicle travels 10 kilometers, that is 10 kilometers vehicle kilometers of travel. If two vehicles travel 10 kilometers each, that is 2 multiplied by 10, 20 vehicle kilometers. So there we use miles instead of kilometers. It's the number of vehicles multiplied by the distance. So maybe one vehicle traveled to come here today 5 kilometers. So that is 5 vehicle kilometers. Another vehicle drove 12 kilometers. So now we have 2 vehicles, total is 5 plus 12, 17 vehicle kilometers of travel. Does that answer your question? Doesn't mean that every vehicle is traveling the same amount. We are adding up the total travel. At intersections, we want to know the activity, the number of vehicles entering the intersection, number of pedestrians within the confines. But for the most part, we have had a lot of difficulty getting data at the intersection level. We talked about it yesterday, I believe. It is all manual in terms of people sitting and counting on clipboards. In the last 5-10 years, we are looking at more video data from cameras that are at intersections and using image pattern recognition. Our computer science colleagues, computer engineering colleagues help identify, was that a person who is walking, was that a bicyclist, was that a motorcyclist, and do that. That's a little better, but not as efficient. The next one, yes? For an intersection, vehicle kilometer, vehicle miles is not the right. It is the ADT, or the number of people traveling. So these are gross measures. What we do for vehicle kilometers of travel is, for a state, we want to compare state 1 versus state 2. Okay. Assam versus West Bengal versus, let's say, Odisha. What are the total injuries, fatalities, so on, and how many vehicle kilometers. We also break it down by rural roads versus urban roads. We can break it down by vehicle kilometers of travel on highways versus medium type roads versus minor roads. So it is more of a macroscopic level than at a specific intersection. But we can also look at individual road segments. In the US, we have fairly good data that we can get for roadway sections. We have 10 kilometers, what is the ADT there? That average daily traffic multiplied by the length of the road gives us the vehicle miles of travel. Here is the injury trends. The previous one was the fatality trends. Here are the injury trends. We are doing some measures of exposure. This is where I was getting at metrics instead of just looking at the raw numbers, raw frequencies, raw counts. What we need to look at is ideally per vehicle kilometer of travel, or per registered vehicle, per capita. If we do not have that, so these are the descending order of parameters. And these are also used to compare data. We showed in the first day, Europe versus Africa versus Southeast Asia versus America, so on and so forth. So those are the gross numbers or gross metrics. Here are the CAPCO scales that I have described to you previously. So on the right here we have the CAPCO scale. But on the left is another one called the abbreviated injury scale. So that goes not from K to O, but it's a scale of 6, but there is a fairly close correlation. 6 is fatal K, 5 is critical incapacitating, 4 is severe non-incapacitating, and then 2 is possible, 1 is minor property damage. How do we make use of this? There is a concept called value of statistical life. The economists who have worked on this for years and years, and let me just walk you through here. Let me just say, in the year 2023, the value of statistical life in the United States was $13.2 million. Let me now convert that to CAPCO. Please follow me on the screen. So what we have here is, on the left, let me just go back to the left. So this was revised for 2023. If you look at it in 2012, the value of statistical life was 9.1 million, whereas in 2023 it is 13.2. Basically, it is in current dollars. Each fatality, each death is equal to $13.2 million is the way to look at it. Now, if we want to compare, okay, we have so many people killed, so many people with life changing injuries, so many people with moderate injuries, so many people with minor injuries, and so much property damage. To bring it all to one comparable unit, one comparable metric, they've come up with a scale saying that if the value is 1 for a K type, the unsurvivable, a critical injury is 59% of that. So the dollar value is 59% of 13.2, which is 7.83 million. Next is a severe injury is 0.26, 26% of a person killed, and that means that is 3.51 million. So now, if you know what is the distribution of crash outcomes in different contexts or different scenarios, you can bring it all down into one numerical value in terms of what is the dollar value. I am using dollars because that is what is in the US. If you can come up with comparable analysis in India, we can use the same thing. This will guide investments in safety, whether it is engineering, enforcement, education, so on and so forth. Just because district B had 1020 crashes, district A had 1000 crashes, doesn't mean that we have to spend a little more in district B than district A unless we do these detailed analysis. So now we go into weighted. So what I gave you was one example of weighting. This is another way of doing weighting. If you don't have the dollar values, maybe you have a focus group of experts from different disciplines saying, okay, if a property damage crash is equal to 1, how much more would you weight an injury crash? How much more weightage would you give to a fatal crash? So in this crude example, I said, oh, based on a focus group, the people, all of you in this class and online, agreed that if the property damage crash is worth 1 point, an injury crash is 3, and a fatality, an injury is 3, not an injury crash, and a fatality is 12 times as bad as a property damage crash. So if I had that, I can go say, hey, in a particular context, I had 1 fatality, 3 injuries, 5 property damage crashes. So what is the cumulative weighted value or impact of all of these crashes? So the 1 fatal crash multiplied by its weightage of 12, the 3 injury crashes multiplied by their weight of 3, and the PDO crashes, we had 5 PDO crashes multiplied by 1 gives us a weightage of 26. This is a very, very trivial or simple analysis. Absent information on the VSL, you could get a group of experts to say how would you rate it, and if they say no, you go from one district to another district, they say no, for us a fatality is 50 times more worse. For the local context that's okay, but you have to come up with common metrics if you're going to compare across regions, geographic regions, and these weights may change year to year. That's what I wanted to show in the previous one. VSL 10 years ago was $9 million, now it is $13 million. So you have to update it further, and I'm not going to go into the methodology. It does not mean that when a person dies, the cost to the family or society is $13 million. It's kind of that way, but there's a lot more that goes into the analysis. There's a team of economists at the US DOT. That's all they do every year is update these. I shouldn't say that's all. That's one of the critical things that they do. Now get together with your teammates, and I want you to do the analysis based upon the data that I have here. So the data I have is a fatality is equal to 13.2 million, a serious injury is 6.8 million, and a PDO is 1 million. Okay, no, not 1 million, it's 0.04. I'm sorry, I changed the number, pardon me. Please use the numbers at the bottom. These were from a previous years, so please use the last bullet. We have the same 1 fatal, 3 injury, and 5 PDO crashes, and using the 13.2 VSL for fatal, 7.83 for injury and 0.04 for PDO. What is the total value? It shouldn't take you more than 10 seconds. Yes, Shayantan?
36.89.
36.89.
36.89, 36.89. All of you have good calculators and good fingers. My fingers are fat sometimes. Instead of pressing 2, I press 3. So I at least have 2 people who got the same answers. That's just to illustrate to you how you can combine these to come up with a common way of quantifying the impact of crashes. Yes?
In this severity means like the serious injury cases like versus fatality, so they had like half of the weightage.
Yes. So I will go back.
Yeah.
And
Yeah.
so the weightage is 0.59. So this comes from statistical and actuarial analysis.
Okay.
So all we need to know is what is the fatality, and then using these ratios you can come up with the other numbers.
Okay.
Yes, Ritwik?
Sir, who is the consumer of these estimates?
Oh, this consumer, we use it incredibly in the United States. So if an agency, it could be a district PWD, it could be at the state level, it could be at the central government level, has $100 million to invest for safety improvements. They get applications for 10 times, 100 times that amount. So they don't have the money to fund all of it. So what they do is try to come up with a benefit to cost ratio. Project 1 is going to cost $10 million, and the benefit from project 1 is 20 million. So the benefit to cost ratio is 2. To capture the benefit, one of the things they have to do is the current safety number is this. If we do this particular project, we will save so many lives, so reduce so many injuries, so on. I'll cover that later in today's class. How do you estimate what would be the benefits? Another group comes up and says these are. So this is used to quantify the benefits. One of the benefits, these are the safety benefits. We quantify benefits for reduced travel time, reduced congestion. Because of reduced travel time and reduced congestion, we have reduced fuel consumption, we have lower emissions. So all of that go into the picture. So typically these are used for benefit cost analysis. And this could be used by government agencies, for NGOs to determine where they want to prioritize their activities or investments. Oh, it's used extensively. And in fact, in the US central government, federal government, they require that we use these VSL to document when we put in an application for funding. We have to use this methodology for the safety analysis. Did I answer your question? So this was 36.9 or something, yeah. Now I'm going to go back to the problem I gave you earlier today. The same thing, we have 1000 and 1020 total crashes in the 2 districts, District 1 and District 2. And what I have added here is VSL. And I'm going to give each all of you 2 minutes, okay, to tell me which district is safer, which scenario is safer. 2 minutes from now, please work with your partners. Maybe one of you can work on District 1 calculations, the other can work on District 2 calculations. So 2 minutes. Akhilesh, what time do you want to break for chai? 11? I have multiple places where I can take a break. I want you to be working with somebody. You cannot sit by yourself. And those online, please work with your WhatsApp group mates. Last row, you're not talking to each other.
Yeah, 11 o'clock will be fine.
11 o'clock? Yeah. Do it, I'll call on you. Tell me your name again.
Sir, Manas.
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 I'll get it. Tell me your name again. You told me that yesterday. I'm sorry. Nishan. Yeah. Is there anybody who needs more time? हो गया. Anybody online who wants more time, please raise your hand. So I don't see any show of hands. Anybody in this room who has not spoken, please raise your hand and I will call on you. Tell me your name again. Tell everybody your name. Yes. Please use the microphone. Ritesh, microphone de dena.
Good morning, sir. My name is Akshay Banolia and I am a PhD scholar from Infrastructure Engineering Management Specialization.
Okay. So what did your team come up with?
Sir,
District 1 or 2? I just want one answer. District 1 or District 2?
One for one, sir. 1, 3, 2, 1.
I don't want sentence. I just want District 1, District 2. You can only say 2 words.
2, sir.
District 2. Okay, you went with one. How about anybody else? Which is safer? Come on. You agree or disagree? Agree? Okay.
Agree, sir.
Agree online. Okay. So I did the calculations and I come up with the following. District 1's cumulative VSL is 1.3 million or billion in this case because the VSL is million. So a higher number is bad. You want a lower number. So even though District 1 had lower number of total outcomes 1000 versus 1020, District 1 had only 5 fatal crashes compared to 6 fatal crashes. However, District 1's A and B type crashes significantly outweighed the corresponding crashes. That's what changed the thing. So you have to take all of it in. But sometimes we don't take all of this into consideration, and increasingly what we are looking from a safe systems approach is we want to avoid or minimize K and A type crashes. We are far more willing to accept the B, C and O type crashes. So any intervention or strategy or countermeasure that will reduce the K, the people killed, people who have life threatening injuries will be given higher priority. So maybe we will not use the B, C and O in these analysis. So it depends on what is your objective, and many times when we look at submitting grant applications or proposals, I don't know what the term is here for funding, you have to look at what is the objective. If they say we want to reduce fatalities, then focus on K. If they say we want to improve safety overall, then you use CAPCO. So focus on what the thing. They may also be more specific that we want to improve safety for pedestrians and bicyclists, then the numbers you use would be corresponding to pedestrians and bicycles, the crashes. Any questions on this approach? All right, so building on this, there are 2 types of crash rates. Professor Maurya asked this a few moments ago, and a couple of you. One is when you look at intersections or a specific location, the level of what we want to know is measure of exposure or activities, how many vehicles are entering, crossing paths. Basically what we are looking at is potential conflicts, for which we need to know the total number of vehicles entering, number of pedestrians entering. But in the United States, so far the pedestrians, we are treating them differently. The standard metrics are number of vehicles entering. So what we do is use the ADT, average daily traffic, to the closest point to the intersection to say, hey, that will be the thing. But I'll show you with emerging technologies where we can be far more precise than that. So here we are looking at annual crashes, total number of crashes every year multiplied by million, because we are looking at rate per million. RM is million, EV entering vehicles. So that's what RMEV is, rate per million entering vehicles. So if we do that, and On roadway sections we will use, instead of ADT, we will use VMT. ADT is average daily traffic. On a typical day, what is the total traffic count, and in the denominator we have 365 for the 365 days a year, because we are using annual crashes over a year. Whereas if we wanted, so for an intersection, this is a simple example, it had 23 crashes, the average daily traffic was 6,500. If you do the calculations that I have outlined, says the crash rate is 9.7 crashes per million entering vehicles. So now you may want to compare multiple intersections to say which is safer or worse. Just because you had more crashes doesn't mean it is worse, but if it had a much higher level of activity or exposure, just in the previous example that we saw, it might be better, safer, relatively speaking. But as many of you said, even one death is one too many. Our goal is to try to get that to 0. Okay. Now if you are looking at roadway segments, corridors, long stretches of highways, not the number of entering vehicles, what is the total distance traveled by all vehicles combined? That is VMT, vehicle miles of travel. And typically we get VMT by looking at, just follow me, my hands folks. If there is a roadway section from my left hand to my right hand that is 10 kilometers long, and on an average day you have 100 vehicles that travel on this, the VMT is 100 vehicles multiplied by 10 kilometers, that is 1,000 kilometer vehicle kilometers of travel. That is what we do to estimate VMT in the US, is we get spot counts of traffic, but with today's technology we can get it better, because our mobile phones tell you exactly how far they travel. So in this example what I have is a roadway segment is 17.5 miles long, the average daily traffic is 5,000, on average you had 40 annual crashes, so the crash rate is 40 multiplied by, because we are doing million, 17.5 is the length of the roadway segment, ADT is 5,000 and 365 days of the year, gives us 1.25 crashes per million vehicle miles of travel. So we can do this to compare two roadway segments, we can do this to compare two districts or two municipalities, to panchayats, two states. You take into account all the crashes in the state, and now VMT we will have to do it, okay, on the national highway system this was the VMT, on the state highway system this was the VMT, and many times you will have to come up with estimates, you may not have actual counts. If you look at activities that are done by organizations such as the World Bank, the Asian Development Bank, so on, they are unable to get, or from the locals, so they come up with some gross estimates based upon population, number of registered vehicles, extent of roadway, economic activity, population centers, to come up with some of these estimates of ADT and VMT. Now transitioning to the highway safety manual, I plan to take a break at 11 a.m. Okay. So before that I just want to give you all 30 seconds, just stand up, stretch, raise. We have been sitting for about an hour. Those online also, you can stretch, take your eyes off the screen. खड़े हो जाओ भाई, it's a chance for you to get up and all right, you may sit. If you have not heard of the highway safety manual, please raise your left hands. If you have not heard of the highway safety manual, please raise your left hand. Daniel and team, did you hear the question? If you did not hear of if you have never come across the highway safety manual, raise your left hand. Keep it raised. You've heard of the online too. If you have not heard of the highway safety manual, left hand up please. Well, you can only show your hand, the emoji. At some point, I'd like all of you to come have your camera on so that I can have a photo. Are you all willing to turn your camera on now? Let's just do that right now. Please turn your cameras on for the next 10-15 seconds till we can get a screenshot. And I'd like to see how you look. Thank you. Others? Okay, I'll go with whoever I have. Thank you, Tushar, Pratyush, and hey, no, keep it on, Tushar. I want to get some photos. Yeah. Hey, I'm looking at you. I don't want them to have the back of my head. I want them to see my head. Okay. Anybody else willing to turn on your camera? Aishwarya, Ashutosh, Krishna Kishore, please. All right. So, mil gaya? All right. So our AV people have got it. So I also want to take an opportunity to thank our audiovisual team for their technical support and keeping the room at the right temperature. Okay. Now I told them to keep it a little cooler so you'll be a little more alert. Just kidding. No. Thank you all for turning your cameras on. So the Highway Safety Manual is something that's been around now since 2010 in the United States. It's patterned after similar efforts around the world. And in the next several slides I'll describe it, and it is used extensively. Once again, to come back to your point, Ritvik, about how do we use what I just showed you, is how do we document, okay, if we did this project, if we did this change, this intervention, the number of fatalities will decrease from 12 in 5 years to 10 in 5 years. There are ways to look at. So this has certain approaches or methods that will help you estimate the benefits. So the Highway Capacity Manual, I will go through. It is a predictive tool. Hey, let me ask my faculty colleagues, if I give the PDFs to you during the breaks, I can convert it. When might you be able to share it with the participants of my slides?
So we can like just combine it and share it with today itself.
At the end of the day today, or yes. Okay, I've been meaning to do that. So you don't have to keep taking notes. I just wanted to make sure. So the next several slides have a lot of text in it, but I will speak to them in a few seconds per slide. Bottom line, what I haven't read here is it provides and offers a set of predictive tools to estimate the frequency of crashes and the severity of crashes due to different types of interventions or safety improvements. So here are the steps. I'm not going to look at it, describe it in detail. The first is network screening. So you look at what you have. Then the diagnostic and countermeasure selection. So network screening also identifies not just the roadway types, divided roadway, not divided, rural, urban, roadway characteristics such as speed limits, number of lanes, freeways, non-freeways, I don't know if I mentioned that, and where you have crashes, how many crashes, what types of crash outcomes. Based on these, the second step is to come up with what would be potential countermeasures, and for each countermeasure, what would be the benefit, and based on the benefit is the economic appraisal, exactly the point you asked, Ritvik, what would be the difference in, and then after we deploy it, we evaluate, did we actually achieve the gains that we projected that we would get. If not, we will go back, feed that information into all the data that goes into the Highway Safety Manual's methodological approach to say, oh, we thought we will have a crash reduction of X, now it is X minus delta based upon hundreds of such deployments. So it has what is called crash modification factors, and I'll talk to you about crash reduction. There is a whole catalog saying if you did this in such and such a context, you will reduce the crashes by this amount. So the Highway Safety Manual has 4 parts. The first one is introduction, part A. Part B is the safety management process. Part C is where I will focus a little more, and part D is the crash modification factors. The C is methods, D is the factors. Did Dr. Pulugurta cover any of this when he was here on safety?
But
this audience is different. Yeah.
Different. So
okay.
That was like 3-4 years back.
Okay. So, I'll let you folks read what are these. Let me go into more of the details. So, the predictive method is to come up with what are called safety performance functions. What they do is enable the analyst to come up with an estimate. I want to make sure that you all understand that these are, we are coming up with estimates of what might be benefits. What is the average? Once again, it is not, oh, you deploy it and in 1 year I didn't have that. It is meant to be much longer term, for many years. What do you have? On a network, which could be an area or similar types of roads in a particular district or a state. It could be a very specific facility where you have an intervention, the national highway that is going from here to there. It did not have some of these features. Maybe it is rumble strips on the edge. We are going to put rumble strips over the next 30 kilometers on the national highway. So, what might be the safety benefit? The rumble strips may be appropriate because we saw that we have a lot of run off the road crashes. So, the intervention or countermeasure is going to be based upon the type of problem you had. So far we talked about a lot about type of crash, fatality, injury, so on, but both in my presentations yesterday and Professor Maurya's presentation, we went over the accident report that describes in greater detail what actually happened. Was it a single vehicle crash, head on, side swipe, T-bone crash, where did it happen, daytime, nighttime. So, the strategies or interventions or countermeasures would be based upon a collection of these factors. So, we look at that, and table 1 chapter let me go to the next. So, I will walk you through this. Table 1 in part C has predictive methods for different types. Chapter 10 is focused on rural 2-lane 2-way roads. Rural roads, not urban, 2-lane roads and 2-way, no divider, no separation of traffic. And there for chapter 10 you have now undivided, again you do not have divided just by definition of that, and so that is the roadway segment. And if you have junctions or intersections, what is the stop control on the minor leg? So, this is the major street, you have minor streets. Do you have 3 approaches, 4 approaches? Is it signalized? Because even a 2-lane road, rural road could have, but keep in mind all of these are based upon the US and Canadian context for the most part, and some may be from other parts of the westernized or developed countries. So, please be very, very careful. Do not use those factors. Just say, oh, the CMF from the highway capacity, highway safety manual said this. That might not be appropriate in Ethiopia or in Bangladesh or in India or in Sri Lanka. That's something for research opportunities. If you are all looking for your master's and your PhD topics, can you look at these to come up with what are the benefits? Here was a problem. The state PWD or the National Highway Authority did such and such, and afterwards this were the outcomes. So, you can document. The next chapter 11 is rural multi-lane highways. So, multi-lane highways could be either undivided or divided, and once again you have stop control on the minor approach, 3-leg, 4-leg, or signalized on 4-leg. And then chapter 12 is for urban and suburban context, arterials. So, you have all of it. It could be undivided, it could be divided, and you have stop control or signal control, 3 or 4 approaches. So, this is the framework. When you look at the tables that are in chapter in part C of the highway safety manual, these are the ones that you need to look at as appropriate. So, we are looking at the estimated, what is the expected number of crashes on average over an extended period of time. If you do not have any crashes, maybe you are building a new roadway where nothing was connected before. So, you can use comparable scenarios elsewhere to say, okay, if I built it as a 2-lane without rumble strips, what might be it? Well, to build the rumble strips for the next 30 kilometers, it is going to cost me so many lakhs of rupees. But by building this rumble strips, even if I spent, let us say 30 lakhs of rupees for 30 kilometers, we will save 2 lives over the night. So now you do the benefit cost analysis. This is the cost, this is the benefit. The basic elements that we need are historically what have we had for a specific site. I keep coming back. So what is it, right? Rural, is it intersection, is it 3-legged, 4-legged, so on, as stop control, traffic signal, is it a corridor roadway segment. So be sure that you are using the right context, and this is based upon, if you haven't studied it, the empirical based method of analysis to combine the estimation based on statistics of historical observed data to come up with what might be in the future. So the safety performance functions are used, and then let's see, and the crash modification factor is the ratio of the effectiveness. Rather than going through the definitions, let me give you some numerical examples. I have 2 more slides with some definitions. So there is yet another term called the calibration factor. At this time I am going to say just assume calibration factor is 1. Nominally it will be close to 1, saying okay, in district 1 or in city A this was it, but city B has got some minor differences. So instead of it taking exactly what it was, it will be 0.99 or 0.98 or 1.02, 1%, 2%. I do not expect that factor, the calibration factor, to be 5 or 10. It is going to be close to 1. For our discussions here, just assume that is going to be 1. You know what happens when you assume? How do you spell assume? A-S-S-U-M-E. You make an ass of you and me. So the method is, on the left hand side of the equation we are predicting what likely would be the predicted number of crashes for a particular year and a site based upon the predicted average crash frequency for the base with the SPF for the particular type of improvement. CMF 1, 2, 3, maybe you are doing 2 or 3 or 4 safety improvements. So we have a CMF for 1, CMF for 2, CMF for 3. So it has got a multiplicative effect, and the last CX I told you, just use that as 1 for you. Now for each facility type we have the crash modification factors. Let me go to the example here. Is this screen visible on the, for those of you who are online? The table, are you able to read the table? If you are not able to read the table, please speak up. Not hearing that, I am going to proceed saying that you all can read it. So what do we have here? It is a particular table for crash modification factors to provide a median on multi-lane road. So the treatment or the engineering countermeasure is you are going to provide a median to separate the opposing traffic. And the roadway setting, if it is urban, arterial multi-lane, rural multi-lane, we do not know what the traffic volume is, because again some of these countermeasures are applicable if you have low volume, medium volume, high volume. So you will see different numbers based upon the different volumes. And so what we have here is the accident type or crash type, severity type. For all types the crash modification factor is 0.78. For all types of injury, non-injury, it is 1.09. For urban, rural, all types of injuries is 0.88, non-injury is 0.82. So look at this non-injury here, it is 1.09, greater than 1. In the previous slide I showed you, it is a multiplicative factor. If the value is greater than 1, what means is that crash number is going to increase. Why would we want to do that? Because we are going to reduce by 22%, 78% the injury crashes. So going back to our VSL calculations, the benefits that we derive from reducing the injuries outweigh the disbenefits or the costs by having non-injury crashes. So not everything that we do will always have a positive outcome. There will be some that we do, whereas in the rural setting it is positive in both whether it is for injury or non-injury. Is there anybody who did not understand this concept? Ritvik, no? Let us say we are going to provide a median and it is on an urban roadway. And by providing a median, historically we had 10 injury crashes per year and we had 20 non-injury crashes per year. That is the baseline. But by providing a median, the expected number of crashes that have injuries is going to be 10 multiplied by 0.78 or 7.8 injury crashes. By providing the median, the non-injury crashes, what was the number I used, 20? 20 is going to go up by 20 times 1.09, so 21.8. So we have a reduction from 10 to 7.8 on average for the injury crashes and an increase from 20 to 21.08. Now we use the VSL value for injury crashes, that was 5 million, for non-injury crashes it was 30,000. So multiply the two. The benefits of reducing the injury crashes are much higher than the increase caused by the injury crashes. Ritvik, is that clearer now?
Now it's clear. So just can you reiterate, how did you get back to the CMF here?
So these CMFs are based upon dozens and dozens, if not hundreds, of observations at various places across the United States. They had a problem, they did a certain treatment, they saw what was the situation before, they documented what was the situation after, and then they come up with this. In this case, maybe a median. There were hundreds of locations where there was no median. Before the median was there, here were the safety records. After they put in the median, here are the safety records. So it's based upon data. And that's what I said. Maybe in your jurisdiction, you did this and you found that I don't have 0.78. The benefit I got was a reduction of 85%, not 78%. I mean, a reduction of 15%, not 22%. You report that. Azaki may have said, okay, in my thing, I got a reduction of to 0.75. Somebody else may say I got a reduction to 0.66, somebody may say 0.93. So all this database is continuously updated. It's just not set in stone. Let me go. So here's what I had told you previously, the crash rates at intersections based upon million entering vehicles and roadway segments is per VMT. How do we apply that to the crash reduction? So what we have here, please follow me on the screen, is the crashes prevented were the number of expected crashes if the countermeasure was not implemented. So all the multiplication on the right side will be 1, right? Before and after will be exactly the same. But now if we implement a countermeasure, the crash reduction factor is CR, and the ADT after improvement and ADT before improvement, we want to account for is there a change in traffic volumes also. So that will be it. So for each countermeasure we will have a reduction factor. So if you have multiple countermeasures, how do you account for all of that? This combined CR will be CR1 plus 1 minus CR1 times CR2 plus 1 minus CR1 multiplied by 1 minus CR2 multiplied by CR3. I will work out a couple of problems to illustrate how you apply it. But the point here is why we have the 1 minus thing is we have already accounted for CR1 thing. So that is why on the second term we have 1 minus CR1 multiplied by CR2. The third term we have already accounted for CR1 and CR2. So it is 1 minus CR1, 1 minus CR2 and then CR3, so on and so forth. Is there anybody who didn't understand this concept? If so, please speak up. Okay. So let me go through some examples. Here over many years, I am not saying how many years, there was a 2-lane roadway that on an average had 10 crashes per year. To improve the situation, we are going to do 2 engineering interventions or countermeasures. The first intervention is we are going to widen the shoulder. The shoulder was too narrow, we are going to widen it. I did not say by how much are we widening it, by half a meter, 1 meter, 2 meter, does not matter, we are widening. And the second thing is we are installing a rumble strip. To me what this means is the problem was vehicles were running off the road. So that is why the widening the shoulder and the rumble strips are appropriate countermeasures for that. So now we have 2 treatments, and corresponding to the 2 treatments, how do we apply the CRFs? So for treatment 1, the crash reduction factor is 0.14, and for treatment 2, the crash reduction factor is 0.15. So what is the combined benefit that we will derive by implementing these 2 countermeasures? So just as I said at the bottom of the last slide, the combined CRF will be 1 minus CRF1 times 1 minus CRF2. And here is if you have not seen what a rumble stripe, this is actually a rumble stripe where you have the rumbles and the paint on top of it. A rumble strip would be the rumble is outside of the paint, the difference between a stripe and a strip. So the calculations are as follows. It gives me a cumulative crash reduction factor combined of 0.27. We had 0.14 for 1, 0.15 for 2. So it is not 0.14 plus 0.15, which should have been 0.29 using the formula. The combined effect is 0.27. Another example, same, we have the 10 crashes per year, but here are more specifics of the types of crashes. 4 were run off the road crashes and 6 were head on. 4, the vehicle just left the roadway. 6, you had a head on collision. So the countermeasures were shoulder rumble strip and cable median barrier. The shoulder rumble strip will only help excuse me, address the run off the road. The median separating will only help address the head on collisions. So logically, the crash reduction factor that corresponds to the rumble strips should only be applicable to the 4 crashes that went off the road, right? And the median crash reduction factor should be applied to the crashes that were head on. So that is how we would apply it. So for treatment 1, the reduction factor was 0.15, and for treatment 2, the reduction factor is 0.44. So what we have here is we had 4 out of 10 crashes that were run off the road. That is what I have in red. The black underline is head on. So the 0.14, I have a typo. I told you my fingers are fat, so this should be 0.15 here. Okay, 0.15 multiplied by 4 run off the road crashes out of the 10, or 40% of the crashes, and 0.44, which is the crash reduction factor for the median barrier, which will help address 60% of the crashes, 6 out of the 10. So the combined benefit is 0.32. Ishita, are you clear with this? Thank you. Is there anybody to whom this approach is not clear? That will have to do more behavioral changes. It is based on we did this, how are the road users responding, or maybe combine it with others, better lighting. So for each CRF, unless the users respond to the treatment differently. So you are looking at millions of users who are doing this. So one person changing behavior may save a life, but overall aggregate, it's not so easy to change the CRF.
Yeah, but sir, I still want to know one thing. So let's say this gets implemented.
Yes.
Now you start monitoring again the crashes.
Yeah.
And it definitely shows that the crashes have reduced.
Yes.
good. Let's say the crashes have come from a different factor.
Yeah.
Not unanticipated, right? So then what is the decision? Should we try to change the CRF? What should be
No,
our
the
objective?
CRF will not change. Okay. So what we will have to account for is, the question was what happens. Well, we have the benefits by reducing the number of run off the road crashes and head on crashes. However, we had a few more rear end crashes, let us say. What can you do to that? Well, the intended benefits were accrued from the two that we had. The unintended was rear end crashes. I don't know, I'm just using that. So what else may you add? What other countermeasure may you add? Or if there is clear evidence that these two countermeasures are indeed causing more rear end crashes and we cannot do anything to mitigate that, now then you have to verify, say, like we did the VSL, the benefits from these reduction of these two crashes is so many dollars, the disbenefits from the rear end crashes is so many dollars, which is better or worse.
But we can use a visual also, right? On the road now.
What
Like many roads have those prone to accidents.
Yes, yes, we can add. So that is yet another countermeasure. That's a signage. Okay, add signage.
So that will not change the CRF.
No, that is because you had another countermeasure.
Ah.
Okay, that's not due to this countermeasure. You're putting more chevron signs, let us say. Okay, I've got 2-3 minutes. Let me give one more example. Here is a situation where we have 12 crashes at an intersection. Not 5 are left turn crashes and 7 are angle crashes. Again, I'm using different colored fonts to help you track. For us, left turn in the US is the same as right turn here, okay, because we drive, as far as people in India are concerned, on the wrong side of the road. So 5 left turn crashes and 7 right angle crashes. 2 treatments. Treatment 1 is to create a positive offset to left turn. So this is the geometric design. You're offsetting the left turn lanes so that there's better sight distance, line of sight for approaching traffic to look at opposing through traffic. Treatment 2 is we are adding a 3-inch yellow retroreflective sheeting to the back of the signal head. I haven't seen much of that in India. You have a typical signal head, but behind that we use another color contrast to improve its visibility. So now very clearly, not all of the treatment is going to be for. Left turn has a CRF of 0.38, that will be applicable to this 5. The retroreflective sheeting is going to be applicable to all. It affects the left turn as well as the angle crashes. So this is an example where I wanted to use one crash reduction factor is applicable only for one set of problems. The other crash reduction factor applies to both situations at hand. So the 0.38 applies to the 5 out of 12 crashes. So I'm just getting a proportion, whereas the reflective treatment will benefit both problems. So the combined CRF is 0.31. So I had inserted this blank slide saying that I'll be here approximately at 11. We can break now.
Yes.
And I have more slides that I will cover in the next lecture. Okay. I told them that I have more slides that I don't intend to cover all here. Some of it is for this afternoon and some of it is for tomorrow morning. As we talked about, we may try to address some more today. Yes. Any comments from the, yeah, before I take a break, questions, comments, concerns, and I was going to ask for administrative comments. Any questions, comments, concerns? Yes.
Sir,
Speak up.
as you have talked about safety performance function, as we also say it is a performance indicator in the highway safety manual.
Yes.
Sir, the nature of the performance indicator for the sections and the intersections will be same or not, sir?
No, they are different. Each one has to be handled differently. Roadway corridors, we come up with different treatments, different solutions for problems. At intersections, it is very different. So we have to evaluate each one separately. Unfortunately, I don't have time today. There's a whole class, one semester long class that I lead on safety and the use of the highway safety manual. I'm trying to cram that in about 90 minutes for all of you. Online, any questions? Okay.
No, sir.
Yes?
No, sir, no questions.
Yes, does it?
I mean, sir, no questions. Okay, it's okay.
No, if you have a question, I'm happy to address that.
No, he said no question.
No question. Okay, all right. I thought you said I said.
Sir, I have one question here.
Okay.
Hello.
Yes,
Yeah.
Ritesh.
As we have seen in your slides that accidents causing a huge economy loss.
हाथ दिखा पहले.
Crashes are causing huge economy loss.
Thank you.
So we know that the maximum crashes are happening because of the overspeeding.
Here in India.
In India.
Okay.
So can we reduce the speed and the severity will be reduced? So in US, is there any study that comparison between the economy loss by reducing the speed, because there will be loss because of the time value and money?
Yes.
So what will be the difference in the loss of economy by reducing the speed or versus the severity which is causing the economy loss?
That's an excellent question. The question for those of you online is that at higher speeds, the safety outcomes are much worse. So one way to improve safety is to reduce the posted speed limits or lower the operating speeds by using whatever techniques. So we may improve safety. However, when you improve safety, the travel times, when you reduce the speeds, travel times are going to be greater. What is the trade-off between the loss of economic value from the increased travel times versus safety benefits? Off the top of my head, I do not have any references to comment on that. I would recommend that you go to TRB, the Transportation Research Board website, look at TRID, their Transportation Research and Information Database, and do a quick search. It is free for anyone to access, but I suspect there are plenty of studies that have done that. I haven't explored that. I'm sorry. TRB, Transportation Research Board.org, and within there you will see a number of links. At the top you'll see a banner and it says database and resources, and within database and resources, TRID, Transportation Research Information Database. You can query. That is perhaps the most extensive reference or resource to identify any transportation related. It could be law, it could be public policy, it could be health, and of course engineering. And you should be able to access at least the citation, the abstract, and for the most part, depending on who the publisher is, you will be able to get access to the publication. But some publications may charge you access. I do not know what the IITs here or the NITs or the other institutions have for subscription to. If it is an Elsevier journal, TRB is not going to make it available for free to you. You have to go through the copyrighted process for Elsevier. I'm just using that as an example. All right, folks, let's take a break until 11:30. Yeah. All right.
Hello. Yeah. So online, whether you are able to hear me? Yes. Anybody can unmute and confirm. It's still there. That's not over. Online, anybody is there?
Sir, volume is very low.
So volume. Hello. 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 Yeah.
Yes, sir. Now fine.
Okay.
Fine, sir.
Okay. Thank you. Thank you. Okay. So welcome back. So Professor Shashi has already set the platform, and he has talked about like many of related aspect of crashes, that how to do scoring or give importance to different type of crashes based on the US manual, US safety manual. So in this lecture I will try to see the similar thing, but maybe Indian context, that in context to Indian Road Congress codes, that how IRC codes deals with that kind of thing. So we will talk about like what is the black spot and how the black spot is defined as per Indian context, and then like how we can prioritize the different black spots, and then what are the remedial measures. So that we are trying to cover in today's lecture. So there are like three key safety principles which like in lecture 1 Professor Shashi has already talked about safe system approach. So first principle is that like recognizing that human frailty is that like maybe human can get hurt, or maybe they can like make, then next is like human can make mistakes. So we cannot assume that drivers cannot make mistakes. So we by design we can assume that human might make mistake, but we need to create an environment in such a way that even if driver make mistake, so the consequences should not be too serious. So based on that we have this circle where like maybe in core we try to work to prevent crashes that result in death or serious. So our all effort being traffic engineer to reduce the seriousness of the injury or maybe death. So all force system is that like we wanted to make road safe, we wanted to make vehicle safe, we wanted to make like speeds under control, and at the same time we wanted to have like safer pedestrian movement. So this principle is like endorsed by doing kind of maybe licensing and registration, stricter policy, education and enforcement, innovation, the way we implement, the standards we can strictly enforce, coordination between different organizations, data research and evaluation, road rules and enforcement. All these are the ways through which we try to achieve this safe system approach. So we will not go in detail in this, but like these are the basis on which like the entire thing has been developed, and the basic definition of crash is that like road crash is a rare and multi-factor event. So it is not that regular affair. So although we keep seeing the accidents daily basis, but actually it is a rare event. It is not that like we are expected to have crashes everywhere. or every here and there. At the same time, they are not only one person's fault. There might be multiple factors which like work together for any accident. So, where one or more road user have failed to cope up with the road environment. Whatever road environment we are providing, we anticipate that driver should behave in particular manner, but as a user he fails to either perceive that what is the designer's perspective behind designing that road, or he does some other error. So, maybe like you design a sharp curve, you put the speed limit, maybe user are not able to perceive that as a sharpness of that curve, or he failed to perceive that there is a speed limitation implement in that section. So, there might be many such combination of failure which might lead to any crash. So, why this is important, that like we should focus on solution rather than direct cause. Sometimes what happens, like if you see the incident and you try to look for the reason why the accident happened, if you do not dig in deeper, so then you might not able to get the correct cause of the accident. Like for example, say a vehicle run off from a road at a sharp bend, driver died due to impact of vehicle sliding down in high embankment on a valley side. So, this is a event which occurred. So, a traffic policeman went to investigate that. He found that driver was travelling fast and he was under the influence of alcohol at that time of crash. So, his conclusion is like the traffic policeman conclusion is that this road crash was due to dangerous driving and influence of alcohol. So, this is a half truth. So, he may not see that other factors which has not given him enough warning for that kind of impeding situation. If you see the same scenario, if a like a traffic expert or experienced road safety auditor visited, or crash investigation happen in scientific manner, so their findings are following. So, sharp bend come after a long straight stretch. So, once you have long straight stretch and then sharp bend, so in long straight stretch the tendency is to increase the speed, and suddenly you had a sharp bend. So, it become very difficult to control the speed. So, this kind of combination if we are going to provide, that will always be dangerous. So, you cannot have a long straight stretch and then sharp bend. So, before that you need to introduce some mild curve, so that like speed goes down and then you can have a sharp curve, or you should have enough warning to that situation. So, sharp bend warning sign was not placed, or maybe not replaced once it got damaged. So, that is one. So, root cause, first root cause might be this, which like encourages the driver to have higher speed once he is approached to a particular sharp curve. At the same time, you had not given the proper warning, and at the same time once we say that our infrastructure should be like kind of in such a way that if driver make mistake, he should be able to like adopt that, or he should able to protect. So, that side road safety barrier was missing, which might have prevented this vehicle going down in valley. So, these are like, then if sign had been in place, driver might have probably reduced the speed, or if barrier would have been there properly, this may be extent of the accident may not be there. Now, these are two different analysis of the same event. So, whenever like such kind of accident happen, we should start looking into that like root cause which might be creating a particular kind of scenario which might be perceived by the driver, and then driver actions. if you see only driver action, you don't go the like root behind it or cause behind it, you will not get the correct reason. So, even in with the previous conclusion, here if you do the driver training and those things at that location, it may not be effective until unless you implement and figure out all those causes. So, this is a simple example just to give that like any incident once we see or crash you see, the how you are going to investigate that. Okay. Okay. So, then like black spot, what is the like we keep seeing or keep hearing the name like term black spot, or sometime it is called like hot spot. Gray spot is slightly different. Okay. So, it is like it refers to a specific location or stage where high number of accidents or crashes are expected to happen, which might be fatal or maybe serious injury crashes. Okay. So, property damage and those things may not be comes under hot spot or maybe a black spot location. So, this analysis of or like identification of black spot locations are important, so that we can do the preventive measures in order to reduce the number of accidents. So, why we require like to identify the black spot? One is that like you if you target for road safety improvement, you need to know that where to do that and where it will be most effective. So, black spot are those locations. Other is that efficient use of resources, because you may not have ample amount of fund. So, if with the limited fund, all accident locations you cannot treat. So, you need some priority that okay, like stage 1 you are going to spend maybe only 100 crore. So, 100 crore where to spend? 100 crore may not be enough to treat all the accident locations. So, then you need some kind of priority in order to efficient use of resources, so that if you whatever money you invest, maximum amount of accident reduction you should be able to get. Then data driven decision making. So, if you had this kind of crashes data and with the location, with the severity level, then you might able to decide in better way, efficient way, allocating the like resources in a most efficient way, so that like you can have a maximum reduction with the available resources. Okay. So, MORTS definition is very straightforward in terms of like defining the black spot. So, black spot or a road accident is black spot is a stretch on national highway or any other road is about 500 meter length. So, it is not too small, not too long. So, in which either 5 or more road accident in past 3 years took place. So, that happens like took place in last 3 calendar year. So, 5 more are accident which is like of this nature, which include fatality or serious injury. So, or in other case, even if one accident happen, but your fatality is 10 or more, then also that location is called as like black spot. So, even if bus accident happen at particular location, if fatality is 10 or more in last 3 years, so that is spot will be treated as black spot. Okay. So, now here this number is fixed, the length is important. So, 500 meter stretch you need to choose. So, how to choose that 500 meter stretch, that is important. So, now in this like suppose you had given this kind of scenario where this is a 1 kilometer stretch length, and then engineer like started, okay, this is 0. So, he divided 500, then 500. Now, whether it is like qualify as a black spot or not? Yes or no?
Sir, if you do like if you just give it a right time, so then it will be a more helpful, more accurate.
So, with the current division?
No.
So, whether it is correct division?
No, sir.
No sir. Okay. Any other comment? So online audience, any comment?
Sir, it depends. Sir, it depends on road condition actually. Anywhere black spot it's happen, but it's depend if potholes is there, if any wrong interaction junction is there, then anything means it's not a particular scale is there. Black spot
So
will
here,
happen anywhere.
sorry, maybe I did not explain it properly. All this red dot is like a serious injury kind of accident, or might be fatal accident, single fatal accident. So these red dot, you have these 6 dots at, and these are the locations of those accidents in meters. So that is given. So with that information, whether this whatever engineer had divided into 500 meter, whether that is a correct approach?
Yes, sir, that is correct.
So anybody else have
300
any?
or 500?
Yeah. So 500, let us assume, because that MORTH has specified 500. So it's like it can be plus minus 5, 10, 100, 10 meter or 50 meter, but mostly it is 500. So any other comment? Now if we go to the definition, it says 500 meter length. It never said from where to start. So here, sorry, if you start from 0, this is correct. Okay. So then you will have 3 serious injury accident here, 3 serious injury accident here, both stretches safe, but it does not say that like you start it from starting. It says that like you have 500 meter stretch length, it can be anything, anywhere. So you have sliding window, may not be static window, that like you decided from 0 to 500, 500 to 1000, it is not necessary. You can have 100 to 600, 600 to 1100. If you do that, say this is like 500 meter window you have, now you start sliding this window, and if you do that, it might be 100 to 600. Now it become 6 number of accident. Now it become black spot. So this is important to learn, that how to identify the stretch. It's not that like you from starting you start counting 500, 500, 500. So if you plot the accident, any 500 sliding window, if it has like 6 accident, so that stretch will become 500, that black spot. Okay. So that way, like you need to understand the sliding window concept instead of like a static window concept.
Okay, Akhilesh?
Yeah. Yeah.
So one quick comment for those of you who use GIS software, the technical term is called dynamic segmentation. So if you use the dynamic segmentation tool, it will automatically move. Say you want to have 400 meters, 300 meters, you define what the length is, and it will incrementally go and find what are the criteria. The technical term is dynamic segmentation.
Yeah, thank you. Yeah. So that way, like because in IRAD you can plot those things over GIS map. So all these like data analysis tools you can use. So dynamic segmentation concept you can use. You put the 500 window, and automatically it will keep highlighting that where this criteria met. Okay. So this was like the criteria, which was like for Indian context. Then there are like different country might have different criteria. Okay. So we will not go in detail. Already Professor Shashi has talked about US. So different country has different. Many of they don't believe in 500 meter. They will believe in like crash potential or fatal crash per kilometer in a year, or maybe sometimes crash frequency they believe. So that way, like in Indian context, whatever definition, let us like go ahead with that definition. And in this, like 4 main tasks to treat an accident, like kind of road where bad condition records are there. First, like we need to have like either figure out black spots, then treat. So these are like 4 different strategies how you are going to treat or make a road safer. So, either go black spot wise, or you identify a particular route and treat the entire route, or you figure out certain common type of crash which might be happening in that location, and you identify all those crash location and treat those all crash location, or you can identify that area, that okay, in this area maximum accidents are happening. So, then that area can be treated. So, most of the time we go ahead with black spot, we identify black spot because like still we do not have enough fund to go ahead for the entire route until unless that route become very important. Okay. So, then investigating and rectification of black spot. So, why it is necessary? That we need to know that like based on severity of crash, how to prioritize the list. We will subsequently see that how to create priority list. Then crash data analysis at the individual site and diagnostic of the causes of the crashes, and subsequently we select the remedial measure. Then we provide detailed design and implementation of the proposed treatment, and subsequently we monitor that kind of remedial measure, that whether it is become effective or not. Like what Professor Shashi has like talked about crash reduction factor and those things. So, for Indian context we still do not have crash reduction factor. So, it is not that that cannot be developed. The biggest challenge is that we do not have like reliable data of accident over time. So, nowadays like lot many black spots are identified, and MORTH make a mandate that you have to treat all those black spots. So, a phase wise manner, like each state government is like taking up to remove the black spots, but still monitoring and evaluation part is still not implemented. Like we need to see that like in past 3 years before the remedial measure what was the accident scenario, and after the remedial measure what was the significant reduction. So, somebody has to do that, and like say maybe if you had in particular state maybe 400 different black spots. So, our 400 black spot might have like different counter measures which got implemented. Somewhere like you might put rumble strip, you might have widened the shoulder, somewhere like you might have flattened the curve radius. So, different remedial measure might have implemented. So, if you observe the effectiveness of those measures, then you come up with the crash reduction factor corresponding to that measure. If you had say 20 sites where you had like only widen the shoulder, so how much effective it is, how much percentage of accident got reduced, you will come up with that number and then you get the crash reduction factor. So, now we are having this IRAD database system which is like continuously recording the data. So, maybe in future we might have the past data, and then after the countermeasure data we study that along with the whatever measure got implemented, and we can develop the crash reduction factor. Okay. So, these are the basically steps in black spot treatment. You need to like first figure out a black spot, then based on prioritization you treat the black spot, collect crash data, do the analysis, identify that what is the common pattern in those accidents. So, based on the common pattern you try to implement some of the remedial measure, and then you identify the this is like a pattern only. Subsequent like once you identify pattern, you develop the countermeasure. Then based on the countermeasure, like to implement the countermeasure, you provide the detailed design and drawing, and like what will be the cost implication, because until unless you have cost implication ready, the project will not get approved. So, you need to see here show here that like how much cost is required, and if you are going to implement that, what is the expected reduction in like fatality. So, that like is still that reliable prediction of expected reduction is still not there. So, still we get some number and we provide the benefit cost ratio, because we do not have like crash reduction factor in place. Then once that is done, like you have all the drawings and estimates ready, then you tender those things, get implemented and monitor for the next few years that how much is the reduction happen. So this is the like stage 1 to stage 4 of the entire black spot treatment procedure as per IRC code. So this is that IRC code which talks about like guideline for identifying and treatment of black spot. So 2022. So now all these like things which we are discussing today, most of the content is taken from there. So I will share that code itself because now it is available in public domain. Okay. So then in order to determine the priority of that black spot, like even black spot might be also different label. So to understand that what is the grade of black spot, you need to do certain analysis. So one is that like average annual total crash, that you need to figure it out. So 3 years fatality data you need to collect, and that like maybe all different types of road you can collect. So maybe like in your state, if you had like expressways, state highway, national highway, all the segment like separately for expressways, separately for national highway, separately for state highway, you collect the number of fatality in last 3 years. Then you also collect the length of that corresponding road. So like how much kilometer of expressway, how much kilometer of national highway. So after that, you divide whatever is the total crash for a particular type of road, divide by 3 years. So that will give you the divide by 3 years and divide by total number of length. So you had the maybe suppose 50 kilometer of expressway. So in 50 kilometer, if you had 100 crashes in 3 years, so 100 divided by 3, this will be per year, and then divide by the length, it will give you the number of crashes per year per kilometer. So that become like average annual total crash per kilometer. Okay. But here black spot definition says 500 meter stretch. So you multiply it by 2, so that it become like half, you divide by further half. If 1 kilometer per kilometer, this is the AATC, you divide by further 2. So then that will be corresponding for 500 meter. So that value you need to obtain for each type of road. So that will give you the average crash rate in your state corresponding to different type of road. And once that is ready, so you had AATC for 500 meter for each type of road. If that is ready, then you go with the chart. For this, like IRC code had this chart index appendix, where they had this kind of factor that corresponding to AATC that has been listed. So maybe like in your particular zone, whether you ended up with the, this is like AATC for per kilometer, this is AATC for per 500 meter into 3 times this. So if you consider this 0.93, so here you need to divide it by 2 multiplied by 3 value. So this is like 3 times of the annual AATC of for 500 meter stretch. This is 5 times, this is 10 times, this is 15 times. So now you need to compare that how much value you got, whether your value is like more than this for national highway or more than this for state highway, more than this for ODR. If it is more than this, means like your current condition is more than 15 times of AATC for 500 meter. So whatever is the average value, so based on the state data they had come up with the average value. So in particular your district, if you had calculated this thing and start comparing with the average one, then it will tell that like how much severe you are. So particular state has this kind of standard. If your comes like 15 times more, then that becomes basically the most severe one. Say like If you had anything like greater than 15 times, that become your first order black spot. So, once your potential rate, crash potential rate is 15 times or more than the average of your state. So, that needs to be treated first. If it is between 10 times to 15 times, then this is second order. If it is 5 to 10 times, it is third order. If it is 3 to 5 times, it become fourth order. So, that way like you can have order of black spots. So, depending upon the limitation of fund, first you need to tackle all those black spots which is of the first order. Okay. So, this is clear. So, you need to have, yes.
So, this is the ready-made reference from IRC, right? These values?
These values are ready-made reference, but once you try to calculate for your case, so you will be said, suppose you are doing it for Guwahati. So, you figure out in Guwahati how many accidents happen in past 3 years on a particular national highway stretch, on a state highway stretch, and then divide by total length, divide by 3, divide by 2, you will get one number, and that number you have to compare for Assam for that particular vehicle type, for that particular road type. If your value is like is here, it means like close to 15 times. If it is even higher, it is more than 15 times. So, if it is more than 15 times for that particular location, means that is like that stretch is having of like very high order of black spot on that particular stretch.
So, treatment is based on the prioritization.
Based on the that priority. So, in that like if you you will be treating those stretch, taking up those stretch first. Okay. So, that way like you will be deciding the order. So, this is the entire table which is given as like appendix 4.1. For each state they had developed this appendix that is available in the IRC code. Okay. Okay. Then there are like other way of doing the crash analysis. This is one way of AATC. Then other way is that you can do the cluster analysis, you can do the heat map analysis, you can do the grid analysis, you can have the corridor analysis. If you have this IRAD data and you are able to plot over GIS map, all these analysis are possible to figure out that which is might be the crucial zone. So, like in cluster analysis, what you will do, you will maybe trying to plot all the accident and then try to create cluster of different frequency. So, higher frequency like where it happens, that cluster you can tick that okay, here in this neighborhood more number of accidents are happening. So, I will take that treat that location on priority. Similarly, like here, so is this cluster is formed in urban setup. So, maybe like darker color will indicate more number of accidents are happening in that neighborhood. So, maybe that neighborhood you will be treating on priority. So, this is cluster based. Then maybe like you can develop the heat map. So, heat map is also a similar way, but representation is different. So, along the stretch you might have these kind of color coding. So, darker color again indicates that more number of accidents are happening in that zone. So, it will if you see that map, you will be able to realize that which location is more crucial on that particular stretch. Okay. So, that is another way of figuring out the location. So, here we are not identifying the black spot as per the definition. Here we are doing based on the cluster analysis. Okay, this zone requires treatment priority. Okay. Similarly, you can make grid. So, you can apply like maybe 100 meter by 100 meter grid, maybe 500 meter by 500 meter grid for entire city or maybe district. Then you see that which patch is like darker. So, maybe that patch requires like more attention. Then you can go and do the in-depth analysis and apply the priority maintenance in that particular grid. Then even corridor analysis, maybe like you can identify different corridor and do the analysis and figure out which one is more severe. Okay. So, like here. Okay. So, Then once you have black spot identification, all the black spot in your area you had identified. So, you need to prioritize that which black spot you are going to take up first. So, in this case for prioritization you need to see that how much accident happen in that each black spots. So, although black spot has like minimum threshold definition, so anything higher than that location will be treated as black spot, but how much higher that you do not know. So, that priority you need to set that based on the number of accident happen. So, whatever process Shashi has like given that weightage, so versus like fatal versus crash. So, IRC says like 10 points for fatal, 5 points for serious injury, which is like almost 50%, then minor injury 2 points, and then damage only 1 point. So, it means that like maybe one fatal accident might be treated as like maybe equal priority with 2 serious accident or maybe 5 minor injury accident. So, that way like it tells about that how you compare or maybe aggregate different type of accident in order to figure out the overall severity of that particular location. So, that way like now in particular black spot, if you want to compare black spot 1 versus black spot 2, you figure out how many number of accident happen in that location, how many fatal, how many serious injury, how many minor injury, and multiply with these points and get a common score. So, whichever is having common higher score, that might be should get higher priority. Like this is like just one example. So, here we had like accident locations 15, maybe this is cluster location, may not be accident location. So, and these are the accidents happen in that location. So, damage only, minor, major, fatal, everything is given. So, different location all 15 has different numbers. If you just simply sum up, so you will get this kind of total number. So, if you go with the number, you will find that like this is or this might be the highest cluster 11, and then location 3, this should be on priority, because these are the having highest number. But if you try to implement scoring business, so here all fatal will be multiplied with 10, all this major one will multiplied by 5, minor will multiplied by 2, and then damage only will be multiplied by 1. And if you do that and figure out the score, you will see the dynamics got changed. Now, even though the total number of accident was lesser, but you will find that this become more severe accident because number of fatal accident was more. So, that is why like you need to see the severity level of the accident apart from the number of accident, which Professor Shashi has given 2 example that like 2 villages and then you have total number more or less same. But until unless you have this kind of bifurcation, decision making is difficult. Just based on the total number, if you go, you might be not implementing your or maybe investing your money wisely. You need to have priority here and maybe here. So, now you can rearrange this entire thing on the this score basis, total severity score basis. Now, based on the available fund, you can start like treating this from the top. If you are able to treat this 3 versus these 4, 5, you might be saving a lot here in terms of safety than here even treating 5. So, if you see if we able to measure only that like a particular state performance, that how many black spot he has treated. So, maybe here you might be treating 5, but once you see the performance that in subsequent year whether accident has been reduced or not. So, maybe accident may not reduce even though you had invested similar amount of money. So, that is why this kind of scoring is important in order to invest the money at the location where it has highest impact. Okay. So, till now any question from online audience?
Sir, Actually, national highway they have chainage. In state highway they also have chainage. Then
Yes.
how to use dynamic
Yeah.
black spot scale? How to utilize, because the chainage is fixed, and NHA or state highway or other district road, they means whatever the management, they also consider only the chainage black spots, not to dynamic black spot. Then how
No.
can
So,
we?
so you will have accident along with the chainage that you can plot in Excel.
Yes.
That you
Yes.
can plot in Excel. Either you, if you are able to plot in GIS map, then things become easy. So, whatever Professor Shashi says, the dynamic window or maybe that you can apply and you can get. But if you do not have, at least you will be having all the accident location in terms of chainage. You put them in Excel, you can either write a small code or do the manual thing that okay, every 5 meter anywhere just you keep sliding, whichever covers maximum number of accident, you put that as a one black spot location. So, whether it is like answered your question? Okay. So, this can be done like maybe either you use some kind of tools of programming or GIS map, or maybe you can do hit and trial. If you do not have like a entire large database, you can do it manually very quickly. Okay. Any other question? Yes.
Sir, in this before slide said the black spot or plotting in a software. So may I know the name of the software in which it has been plotted?
So if you had this, yesterday I talked about iRide. So they had a provision that you can plot those things in a GIS map, because they had lat long. Okay. So even if you had lat long, then you can transport into the GIS map, they will be get plotted. Because for you need a identification point, for that you require latitude, longitude. So if you know the black spot or accident location up to 100, all the corresponding lat long, you can plot it. Okay. Okay. So you can use QBasic or maybe any standard GIS software. There are fewer which are the freeware also. Yes. Yes. It's not switching. Okay, leave it.
Sir, since black spot is related to the road,
maybe you can use that.
As a black spot is related to the road environment factor. So can we are considering here the number of accidents. So are we considering the number of accident irrespective of the cause behind the accident, or with the cause behind the accidents? Like if we are considering 10 fatalities, if there is one accident and 10 fatalities are there, so we are considering it is a black spot. So we are assuming that if a bus is traveling and many passengers are there, so a bus got accident due to some vehicle related factors. So can we consider this as a black spot?
Yeah. So as per the current definition, yes, that will be a black spot. But I agree with your concern that like maybe this may not be very appropriate way.
Yes.
But for many of the field application, you need very clear cut guideline. Otherwise, like implementing those will be a challenge. If you make it subjective and put too much constraint,
yes, sir,
then it will become difficult to implement in the field. And that is why like even though they come up with a very fixed number,
yes,
with no variability. So yes, I agree in those some cases like where single accident involve large number of casualty might lead to a wrong, maybe if it is happens to maybe only driver behavior. So that might lead to a wrong impression that that may not be a black spot, but it will be treated as a black spot. So that limitation we have. Okay. So but and these guidelines are so strict that like you have to follow that, you have to put all the treatment. But here basic assumption is that like we are giving value to the life. So this is like directly linked with the number of lives we are able to, or we could save, or we are losing. So whatever might be the reason, that will come to next step. So here, based on the number of lives we are losing, we are trying to give the priority. So what could be the reason for that? That comes next. Okay. Okay. So once that is there, then maybe like all this accident data. So like you had identified, okay, now we have these 5 locations which we are going to treat. So priority got set, based on the fund we are able to handle first 5. So we are going to next level, that what to do with that 5 locations. Then in that 5 location, whatever number of accident happen, you try to plot them or try to document those data. And an idea of doing that is to get some pattern. So maybe like you plot all the accident maybe in this format, maybe every accident year wise, or maybe accident wise, how many was head on, how many are rear end. So you put them in some table. So idea of like putting in the table format in order to see that like what is the pattern. So maybe if you see that like a lot of accidents are happening, only hit pedestrian, hit pedestrian, hit pedestrian for that particular location. So then you need to see that like what could be the possible reason. So here we try to figure out the pattern. Okay. So even not only table, we can do the this arrow diagram also, or maybe collision diagram. So here like if you see, each individual accident is kept under certain factors and or maybe conditions. So if we see lot many accidents are happening during the darkness means there is some issue with the street light, or maybe lighting, or maybe visibility, that we need to figure it out. So all the accident we put in certain format in order to get the pattern. Okay. So even we try to draw the collision diagram. So how the accident happened, whether it is like rear end collision or front end collision, or what is the location, there might be another collision diagram. So these we try to plot for each of these black spot and try to see that what kind of pattern, whether there is any pattern or not, in terms of type of accident, in terms of location of an accident, in terms of like timing of the accident, in terms of nature of the seriousness of the accident. So all those we try to get some pattern. Okay. And once you are able to like do the analysis and try to get the pattern. So location where pattern like distinct problem is identified. If you are not able to identify pattern, if you are able to identify pattern that okay, lot of pedestrian accident are happening, and maybe they are happening in the late evening side, and maybe at particular this side of the intersection, you can go and investigate and figure out what is the appropriate measure. That will talk about the measures and implement. What will happen if you do not get any pattern? If there are like 10 accidents, but all 10 were different, within the 500 meter they were spreaded randomly, there is no pattern, then that become more difficult, because there may not be a single factor which might be dominating for the accident. There might be multiple factor, and each accident might have happening because of different factor. So there it requires like maybe more in-depth analysis. You go visit that location and see that like maybe you need to treat them for multiple factor, maybe only one countermeasure may not be sufficient for those kind of cases. So but majority of cases like you may get some pattern. So maybe 2-3 pattern together. So one might be related to pedestrian, one might be related to vehicular traffic, one might be related to some other thing. So then 2-3 pattern if you are able to identify corresponding to those pattern, so they already had listed some kind of countermeasures, and then you need to see that whether that which countermeasure will fit well for that kind of situation, and you can go ahead and do that. So if you do not see pattern, go for detailed analysis, try to figure out CCTV videos and those things are related to that accident, see that what could be the situation, that why accident happened, So, that in depth analysis you need to do. But if you see this like one or more dominated type of road crashes which you identified, try to figure out the root cause for that, and then you try to provide the preventive measures for the same. Okay. So, maybe solution whatever you are going to see, you need that solution should do that remove the conflict causing that problem. So, pattern has been identified. Now, I am trying to see what could be the countermeasure we can adopt. So, whatever measures we are going to adopt, that should be able to reduce the conflict whatever causes that accident, or improve the situation. Maybe either you may not be, you are able to, like say maybe this is the intersection. So, there might be a conflict. So, conflict if you are not able to remove, intersection is going to be there. So, provide the warning. So, put that like warning sign that there is a 4-leg intersection, there might be conflict, and then traffic calming measure can be another. So, you had warned the driver, apart from that you wanted to minimize the risk level. So, you reduce the speed, which Professor Shashi has also highlighted. If you reduce the speed, the fatality level is going to, or maybe accident severity level is going to substantially low. Then like go with the first design, like a safety design, safe design principle, and try to see that like the particular location whether it comply with those kind of safe design principle or not. So, these are like 4-5 points which you need to keep in mind while deciding any kind of countermeasure. Okay. Then you need to see that like any specific measures which you are going to see, we need to evaluate on these points. Okay. So, the countermeasure, first thing is that whatever remedy we are going to provide, whether that is cost effective or not, because resource constraint in India is still a big constraint. So, you had a sharp curve, so permanent remedy is make it mild curve. So, that will like resolve most of the cases problem, but like you may not have land available, so you cannot do that, or you even land is available, you cannot invest that much money, or this process itself will take 2 years. So, whether you are going to wait for 2 years with no additional thing. So, you need to see that like whatever measures you are going to adopt or suggest, that should be the cost effective. You start with the economical one, you can have different layers. Maybe if you had like sharp bend, start working with the traffic calming measure first, which can be implemented very quickly with low amount of investment. Subsequently, you can suggest that within 6 months or 1 year, maybe this sharp curve should be changed with the mild curve. Okay. Then whether that particular measure is like adhere to the first safety principle of maybe that particular geometry or not. So, whatever measure you are going to suggest, that should comply with the like first safety principle of that particular geometry. Then whatever measure you are going to provide, whether it will be long lasting or not. If it is not, then that needs to be clearly stated that at this regular interval you need to keep applying this. So, maybe like traffic calming measure, you put a rumble strip marking there, but rumble strip marking will go ahead within 6 months or 1 year. So, you need to clearly write that every 6 months inspection should be made to ensure that like effectiveness of rumble strip is maintained. That kind of instruction should go in your recommendation. Then will it result in excessive increase of other type of crashes? So, maybe like you had resolved one, but you might have created something else. Like in one of the case, there was like a flyover which was like going down, and then it was merging with the flat ground, and just after the flyover touched the ground, there was a divider opening. So, in majority of cases this accident were happening, people pedestrian try to cross, and then because of gradient vehicle comes at the fastest speed and then hit pedestrian. So, here one of the solution could be, which can be implemented cost effective, you put rumble strips. So, rumble strip will slow down the speed. So, might be accident might reduce at this location, but because of rumble strip, pedestrian vehicle might be coming at very fast speed, suddenly they will see the rumble strip, they will slow down. The vehicle which is behind that, they may not realize. So, you will see that over the time this problem get resolved, but rear end collision got started like happening in that location. So, then you need to be very careful, whatever you are going to implement, that should not cause some other kind of problem. That anticipation or that kind of experience you should have, that while suggesting something, it's not that you solve one and create some other problem. Okay. So, will it need…
Hey Akhilesh, if I could interrupt.
Yeah, please.
I know Ritvik asked a similar question. I assure the audience participants that Professor Maurya and I did not discuss this example ahead of time. It just so happened that he picked on a similar example. Ritvik asked the question about exactly the same thing.
Okay, I was not aware.
Yeah, he has, when we talked about the countermeasures, you may do one or two things that improve safety, but inadvertently there's something else that might go the other way. So
Yes.
Ritvik asked a question and we used exactly the same thing. You improve some things and then rear end happens.
Yes, yes, that happens. And like few of the real location, like I had experience with, these things happen. So that's why I remember those examples very well. So then will it like need to be heavily enforced by the police, or need considerable publicity or education? So whatever measures you are going to say like if you had designed such a road where there might be a possibility of like contraflow. So maybe like there is a school, like there is a school on this side, and you had created a junction slightly on upstream side, just maybe 50 meter this side. So you will see that school people who wanted to go that side, and the other side is like 1 kilometer ahead. Now in this case you will expect that people will go 1 kilometer down and come back to this. It may not happen. They may like come 50 meter opposite counter side and cross this. Now here your belief, if you are going to suggest this, that okay, intersection should be at this location, even though knowing that like there might be traffic generator point here, if you are going to accept this, you are assuming that 100% enforcement is ensured, but that may not be possible. So in this situation, if you know that this is going to happen, better to provide provision for that. So maybe on other side you should have wide shoulder where pedestrian can have like, or maybe cyclist can go in opposite direction with protected environment and reach to the intersection. Either you do that, otherwise believing that there will be heavily enforcement from police side, it might happen one day or 1 week or 1 month. After that everybody will be start doing the original business, and that is like natural human tendency, that like they will always minimize their effort, even sometimes they take risk. So that kind of measures when we are going to suggest, we need to be very careful whether that is like, that should not require like that kind of belief that everything will be enforced 100%. Then will it be like friendly for the pedestrian or VR use? So whatever we are going to suggest, that should like acceptable to them. So if we see some place like maybe there is pedestrian crossing, maybe just like making the foot over bridge will not suffice, because foot over bridge take significant effort to cross that road. If road is not wide enough, if like medians are not properly barricaded, even if you provide foot over bridge, nobody is going to use that. So that kind of understanding or like maybe practicality we should consider while suggesting anything. Okay. Then some of the countermeasures. Okay. So, in countermeasures, like already we are 12:30. So, countermeasures we will spend just 5 minutes. I will share the entire code. The countermeasure has long list of like countermeasures. You can just simply go through. I will go through some of them. Like first thing that we need to identify the crash type. Once we are able to identify the crash type, then we will be able to figure out what will be the potential root cause. So, once we identify potential root cause, then we will be able to identify the countermeasures. So, first based on the data, you try to figure out what is the different accident type. So, maybe single vehicle crashes, pedestrian crashes, maybe crashes of vehicle driving in the same direction or opposite direction, crashes at junction, crashes between vehicles traveling in opposite direction, railway crossing. So, there might be, you list down all what are the different kind of accident is possible or crashes is possible. Then these are some example of the factors which might be causing this single vehicle crashes. So, single vehicle crash, like it might happen that a vehicle is run off from the road, maybe at the curve they are not able to take the proper turn, or maybe hit by some object, maybe you had culvert and it's not visible. So, vehicle is like hitting that, or maybe tree is very close by the carriageway, they are hitting to that. So, all those might be the reason for single vehicle crash. Okay. Otherwise, in mid block if vehicle is moving, there is no point in like he will get collide. So, these might be the potential factors which might cause single vehicle crash. So, like maybe excessive speed which does not meet road standard, you had sharp curve, but like maybe driver is not able to perceive the sharpness of the curve. So, he will might be able to move at a higher speed. Then driver fatigue. So, maybe like you had long stretch which is like very straight, and then suddenly there is some abrupt geometry. So, once it is long stretch, so driver get like monotonous and he will like become unattentive, and suddenly if there is some sharp geometry will come, he will not able to act to that. Then poor lighting condition might be one. So, you may not able to see the curve, or you may not able to see the particular object. Road alignment is not clear, he is not able to perceive the road alignment. High speed on the curve, restricted forward visibility from the particular approach speed. So, maybe you are not able to see that what kind of geometry ahead. Narrow carriage width after a long wide section, suddenly you had like a wide road with wide shoulder, and suddenly you had a culvert which does not have shoulder. So, that perception people will not able to perceive until unless properly lit and informed. Then maybe sharp sag curve and crest curve, it is not properly designed, you may not able to see the traffic on other side. So, there are many such factors which are listed in the code. Now, corresponding to these factors, they had identified the possible remedial measure. So, one of the remedial measure in order to reduce the vehicle crash is that speed limit measure, or maybe traffic calming measure you need to provide, so that like people are able to reduce the speed. So, that can be either you have like install vertical speed calming measure, you can have like road signs as well. So, here or maybe like you can have warning signs, or you can have chevron sign, delineator post at a sharp curve. Consider applying speed limit in that particular zone, ensure all traffic island, median, those things, and road sign at that particular location. Install hazard marker on obstruction which are close to the edge. Install clearly visible junction warning signs. So, these are the measures which might ensure that controlling the speed, or maybe reducing the speed, or encouraging driver or warning driver to reduce the speed, as well as improving signage will give you the message related to like impeding geometry. So, there is like then other set of measures which might improve the road marking, that will also help in single vehicle crash. If road marking is proper, you may able to see that what way road is turning. So, even like there might be a measure which related to improve visibility, there might be measures like which related to roadside environment, improve the road geometry. So, that kind of a long list of measure is already suggested in this. So, your effort is that first you identify the pattern on a particular road geometry. Once pattern is identified, try to figure out the root cause. So, among all this list, just you see that what could be the cause which might lead to this result. There might be multiple root cause for a single accident. Maybe you can figure it out as many as possible. You tick those. So, corresponding to that, among these category, you figure out which category might be applicable. So, maybe like say sharp curve case, you might have traffic calming measure as well as signage, both might be required, even lane marking might be required. So, multiple measures might be required, you tick those. So, among each category you might have multiple measures, then among these multiple measures you choose which might be suitable to that particular location. So, even though for a particular measure there are 5-6 for particular achieving a particular objective, there might be 5-6 measures are given, all may not be effective at particular location. So, you need to choose based on your geometry which particular measure will be effective. So, you cannot have like very straightforward rule that you put your condition, you will get with the measure. It will never be happen. It requires a reasonable understanding and experience to identify the root cause, and then how the root cause can be resolved using these measures. So, this is like one type of accident. Then even like maybe pedestrian related accident, there are list of contributing factor, list of possible countermeasure. All these things are given in the ISC code. So, we will not go in detail because like this is long list, and until unless we correlate with the factor and countermeasure, you will not able to understand anything. So, that and correlation will depend upon the specific cases, that what is the exact geometry, what is the type of accident, then what could be the root cause, what could be the countermeasure. So, that has to be studied like for a particular black spot case by case, a black spot at particular location, what are the accident happen and what could be the measure we had adopted. Okay. Now, this is all. So, this is long list. So, maybe like yeah. So, somebody was asking this like yesterday. Yeah. So, this CART means like classification regression tree. This is like a kind of method or which generally helps in these things. We try to help in identifying the what could be the factors behind these crashes, how this segmentation we can do, how we can do the predicting. So, basically it is analysis methodology. Through this we try to figure out like factors and severity and prediction, these things. Okay. Okay. So, thank you. So, any question?
Sir, can I ask I have a quick and simple question right now?
Yeah, maybe you can go ahead.
Yes, sir, as you said that IRC threshold is the crash based definitions like greater than 5 fatalities in 3 years.
Yes.
Does this approach fail to detect high risk locations with frequent near misses? Like I mean, there might be some sharp curves with no recorded accident crashes. How can we quantify the hidden risk there, sir?
Oh, that is not actually listed here. So, in black spot you need clear cut accident data. So, near misses like those things does not account like based on that, because IRAD you may not have this kind of data recorded. So, until unless some crash happen, that will not get recorded. So, if it is not get recorded, you cannot use that kind of data to quantify it as a black spot. So, you can quantify only account only property damage, maybe minor injury, major injury, and fatal accident. That's all. Near miss crashes, maybe because that is not converted into account accident. Yeah.
Yeah, I just wanted to add maybe to his question that recent some of this IRC study, they did something called a gray spot. This is not actually the accidents, but maybe near misses and other less severe incident. Based on that, they classify it as a not as a black spot, but probable maybe spot where risk might be higher.
Yeah, gray spot means that like where you anticipate that in future it might get converted into black spot. So that is called gray spot, means that that particular location has potential to get converted into black spot if treatment has not been done. Okay.
Thank you.
Yeah. So now Ritik, you can ask your question.
Sir, actually I was just reflecting on this black spot calculation. But this is like a post installation of the road, right? After the road has been commissioned, made to use, and 1 year, 2 year, you get to define all the black spots. But can you actually highlight on how does it useful for planning the road itself? Because does IRC actually gets involved when we say that, okay, we are going to connect this zone of the city to that zone of the city using this new road?
So this black spot, once you say already, these are like kind of reactive nature where accident is happening. So proactive nature, their road safety audit comes into picture. So that is a separate one. Here like maybe Professor Shashi has already specified this, we are not going to talk about road safety audit.
Okay.
So in road safety audit, we get all those potential features like a study of that those potential situation which might convert into accident. So those kind of like maybe if you plan a project, so this road safety audit will be at from the very planning stage. So planning stage road safety audit, then design stage road safety audit, construction stage road safety audit, then pre-opening stage road safety audit. So in these road safety audit, we try to see the different element and try to see their potential towards the road crashes, and there we try to rectify before accident happen.
Okay.
So that is like a road safety audit become like proactive approach. So this is like subsequent accident analysis. So that black spot and that once accident happen, then what to do.
Okay, thank you, sir. So one related question, is government only allowed to do this data collection?
No, government has this IRAD system through which it got recorded because they need a authentic database, and that should be accessible to their all hierarchy level. But like people who has like PPP mode highway projects, they also supposed to maintain the accident records. So at the end now with Assam, I could see that like they try to keep matching whether IRAD data is matching with their data or not. But all the people like who are owning that are operating that highway for particular limited period, they are supposed to maintain that data, accident record data.
Okay, so when a new road is being inaugurated, they actually need to keep records of almost everything.
Yes, they have to keep record of accident.
Okay.
Because they will be responsible many of the time design, they choose their design. So they will be responsible if accident happen more frequently.
Thank you.
Yeah. So any other question with the online audience? Okay, so if there is no question, we can close the session here. We will reassemble at 2 o'clock, 2:15. 2:15 because we are already 20 minutes late. So we will start at 2:15.
Sir.
Yes.
Yes, sir. So I would like to ask whether IRAD like have been implemented. Sir.
Yes, yes, I can hear you.
Sir, can you hear?
Yes, I can hear
me?
you. Yes, can you repeat your question? Hello. Hello. Yeah, can you repeat your question? Or maybe he got disconnected. So we will reassemble at 2:15.
Can you hear me?
Yeah, can you tell your name? Hello.
6-year-old computer. Oh, still you are able to use it? Yes. In olden days, you could replace the battery. Now the battery, you have to open it up to replace the battery. But otherwise, functionally, it is good.
Hello, hello.
हाँ बोलो
I need one more. I have a new data set that I want to share with the group. Does anybody have a USB that I can issue? people on the online and people here, please bear with us. Having a new set of data shared with you. You should have it in just a few minutes. Once you have the data, we will start working on the tutorial. And after that, we have a break. And after the break, we will have one more, the continuation of the lecture that I started this morning. Is that okay? Yeah, well, not on. One, two, three, 1, 2, 3. I'm sorry for those online. I do not see who's online. You should be receiving within the next few minutes. It's already been sent. A folder with 3 subfolders of data from the fatal analysis system. Okay, is the meeting reconnected now? Okay, so I hope third time is a charm. You should all have received within the past few minutes access to a new set of data. Once again, it is for the state of Nevada, but these are only for fatal crashes that occurred in the state of Nevada, and I will go over them in just a few minutes. So please make sure you have access to them. Those of you who are online, if you could please show a thumbs up. Just have your hand up or thumbs up once you are able to access the data. Yeah, please keep it up, Tushar. Maybe a raised hand will be better, so that it will stay on the screen. Thumbs up disappears. Thank you. I just see 2 hands up. Ashwini, Ishfaq, Krishna Kishore, Shruti. Please let us know when you get the data. How about people in the room? Is there anybody who didn't get the data? Okay, looks like everybody here has the data. All right, while I wait for you all to load the data, a few comments. I was able to briefly look at the feedback I got from all of you. Thank you all for your responses, the GIAN course feedback. I believe we had 24 of you provided responses, so thank you. I quickly looked through that. I'm sorry I didn't have time to look at it in great detail. I just was able to do it just before lunch and over lunch. I won't comment on what are the positive things, but I wanted to comment on what you suggested that I do differently or do things I am not doing. I may be able to, when I say I, it includes Professor Maurya, Dr. Bharadwaj. Many of you wanted Indian specific data. Unfortunately, I do not have access to India specific data. Professor Maurya showed you some from Assam in terms of the graphics and so on, and as he mentioned, there is a dearth of data related to safety and as the roadways or traffic operation conditions as they relate to safety. So that's an opportunity for you all to try to look at what exists, what are the gaps, and how to make a difference. The other things that a few of you asked is maybe the lectures are too slow to speed up the discussion. I'll try and see if I can do that, but I want to make sure I do justice. I don't believe in just leading and speaking and quote covering materials unquote. My goal is to help uncover or discover. I'd rather go a little slower than a little faster, but if it is too slow, let me know and I will go faster. The third one is a mix. I saw it in both the favorable or continue doing, and I saw it on do less, is explanations and theory or the formulations why we are doing what. A few people said no, we don't want to hear that much as a theory or the science behind it, but several others said no, we like it, so we are able to understand it. So that's a mixed bag. Okay. So these are the overarching comments. I appreciate every one of you who provided the feedback. I should have done it one day earlier, so I would have been able to make changes, or we would have been able to make changes. Online people, please show your hand up. I see Shruti has got her hand up. If you have access to the data that were sent just a few minutes ago, this afternoon. See, 6 out of the, all right. Oh, the other comment for improvement is start sessions on time. Some of it is beyond our control. Yesterday morning, I had an appointment with the director of the institute, so it is I meet with him when he is available, even though we had a certain appointment. I'm not trying to find excuses. We'll do our best to do that and finish on time too. Who's online person, if you can mute your thing. Thank you all. So you can lower your hands now. Whoever is online who has a mic active, please turn it off. Chandrika Prasad Verma, I think you have your mic on. All right, so to switch to the tutorial. Thank you, Ritesh. All right, so you should have received 3 files. They should be named accident, person, and vehicle. They are within a folder called 32 Nevada FARS data. FARS is Fatal Accident Reporting System. Even though in the US we are very, very strongly moving towards using the word crash and not accident, because this is a system that is decades old, they are continuing to use the same acronym. Unfortunately, even the file that they have named is accident file, not crash file. Okay, I don't control it. I cannot easily effect a change, but those of us who work in this domain are trying to bring about a change in the way that we talk about things. So these are very similar to what I showed you over the last 2 days for Nevada. The last 2 days I shared with you one file that had 300 records of primarily crashes that had only K or A outcomes. That was the first. Then when you had a K or A outcome, you may have had B, C or O outcomes. So when you look at the other 2 files, the second file was vehicle files. So for 300 K plus A crashes, we had 480 or so vehicles involved in these crashes. The third file was persons involved in the crash, so we had more than the number of vehicles. So that was a sampling of all types of crashes. What I am going to share with you, what I have shared and will go over, and the exercise you will work on it. Oh, that was the other comment was, please work out the examples or show us how to do it. I am going to hold off on that. I am going to work on have you work on this. I will walk around the room or otherwise, because if I spoon feed you, you are not going to learn how to do it. If you do not have the skills with the data analysis, I am sorry, you have to pick it up. For you to be able to successfully work in this domain, you must have some of the data analytics skills. I will do my best to walk around to guide you, but there are plenty of free online tools, access to tools online that will help you to work on this. Okay, now going to the 3 files that I shared with you. I am going to start with the accident file. It has many more, all of these have many more details than we saw in the last 2. That is because when there is a fatal crash, the data that are recorded are far more extensive than for an injury crash or a property damage crash. So let us start with the accident file. The first column is 32. 32 is just a reference. In the US we have 50 states, and state number 1 is Alabama. It is written in alphabetical order. So Nevada N comes 32nd in the alphabetical order. So that is the number 32. The second is state name, and it is the Nevada, which is a state where I live. The third one is the state case within the state. So you see it starts from 32001 and goes all the way to 320389. There were 389 fatal crashes that took place that year. So that is what it is. Each fatal crash is unique. The next is were there pedestrians, total number of vehicles. I will get into some of these details. Persons and vehicles involved, persons, number of persons, permit, the county where the crash occurred. So you see 1 for Church, oh come on, 3 is Clark County. We have 17 counties, but you see some numbers that are greater than 17. That is because if there are cities involved, you will see some, but essentially a county is a district. Then comes the cities, and the number of the city does not matter. Look at the name of the city. In many cases you will see not applicable because it did not take place within a city boundary. It took place outside a city boundary. The month when the crash occurred, 1 for January. The next one is a narrative of the month. Day, which is the date, day name. So once again these are mirrored columns. I apologize, this is not something I designed, but that is how the database is. You will see several fields that are duplicative. The next one is day of the week. 2 is for Monday. There in the US we start with Sunday as day number 1, 2 is Monday, 3 is Tuesday, and so on. And the next field is a descriptor of the day. And this is for the most recent year where we were able to get complete data for a year. The year was 2022, the calendar year 2022, from January 1st through December 31. Then you have hour in a 24-hour format. 18 means 6 p.m. So the next field says it is 6 p.m. to 6:59 p.m. Minute, pretty straightforward, for 48th minute. Then let me. T-way is travel way, on which road. So this is the first one, says Sahara Avenue. Route, it is a code that you have 1, 2, 3, 4, 5, 1, 2, 3, 4 and 8, and it is basically 1 is interstate, 2 is US highway, 3 will be state highway, and 8 is other, which is not a numbered route. So we have numbered routes for interstate, US highways. US highways are one level lower than an interstate. Interstate is a freeway. A US highway is not necessarily a freeway. A freeway means you can only get on at on ramps and get off at off ramps. There is no other junction. A US highway could have a junction. State highway is one level lower, but it is not a freeway. So that's the route name. Rural or urban. 2 is used the code for urban, 1 is the code for rural, and you will see that written out in the next field. The next is what we have called as a functional classification. Is there anybody who is not familiar with the functional classification, the term functional classification? Show your right hands please if you have not heard of the functional classification. Please raise your hands if you have not heard. Okay, I see several people. All right, so very quickly, one for a function. The functional classification is basically used to categorize the road network across the country, across the state, into various levels based upon the function that the roadway serves. Functional class 1 is the highest class, which is the interstate highway system. It is meant to provide high speed, high volume movement. So you can only get on an interstate system at an on ramp, get off at an off ramp. You cannot get on or off anywhere else. It will have a minimum of 2 lanes in each direction. The opposing travel lanes are separated by a median. It could be a wide space, it could be as simple as a barrier in the middle. So that's the highest functional class. The purpose is to provide high speed, high volume movement. The next would be principal arterial, minor arterial, so on, until you get to 7, which is a residential. When you have a housing colony, for example, streets that serve each of the individual housing units. So 1 is the highest, 7 is the lowest. Is there anybody who didn't understand that? Okay. And you can see, I was talking about it, but this column has the number, the next column has the description. Who is the roadway owner? So 1 is the state of Nevada, 2 is a county or district. I don't know what 3 is, let me look. There's no 3. 4 is a city or municipality. You see 26 is private. 66, we have a lot of state parks and national parks within the state. So if it is a road in a national park, the owner is the national park, 66. So that's the code for who owns it. And in our case, for our analysis today and tomorrow, we may not worry about it a whole lot, but you're trying to address who will have responsibility to make improvements on the roadway. Or if you want to look at whose roads have more safety problems, don't look at it just as a count, as we talked about. You need to look at it as a rate. In this case, you may want to look at it as number of fatalities per centerline mile they own, or number of fatalities per lane mile that they own. The next one is NHS. Is this a part of the national highway systems? There's a system of defense highway network. So at this point, you don't need to worry about that. And NHS-NA, this section is not on the NHS, or this section is on the NHS. You could have one major highway, parts of which are on the national highway system. There could be sections which are not on the national highway system. No special milepost. So you are going to see a lot of 99998 is because they didn't record. The milepost is not appropriate. For example, on a city street, we are not worried about the milepost. Whereas on an interstate highway, let me just pick this. You see a milepost, and you can see very clearly the functional class is 1. It is an interstate highway. and so it is at milepost 200. Then the next two columns are the latitude and longitude. Well, latitude they have 2, longitude minus meaning it is west of the prime meridian. Harmful event, there are codes, and then the next one is the description. 8 is there was a pedestrian. 54 is it was motor vehicle in transport, that is moving. Similar to what we saw last time, but there are numeric codes and alpha descriptors. The type of collision, angle, head on, so on. Okay. Junction, non-junction, on roadway, off roadway. I am not going to go describe all of this, daytime, nighttime, and the specific cover. There certain times of the year it gets really dark where I live in Las Vegas. In the winter months, by about 4:30 it is dark, sun sets earlier than that. In the summer months we have daylight till 8:30 or 9 p.m. The next things of interest are arrival. These are transport to the hospital, arrival hour, arrival minute, when did you transport the patient. Yesterday several of you were interested in looking at from when the incident took place to when it got to the hospital. So you will have it by the arrival and so on. And the last column is the number of fatals. So these are descriptors of the crash. What I want to go on next is the vehicles involved. The unique reference number, like we did over the last 2 days, is the state case number. So remember, it starts from 32001 to 389 or so. But now for the first case there was only one vehicle involved. Let me focus on the second case. There were 3 vehicles involved in the fatality. So you have 3 records. Each of them has the same case number, but this was vehicle number 1, vehicle number 2, vehicle number 3 that was involved. And for each of these vehicles, again you can correlate it by when the crash occurred, the day, date, month. But what is more important here are other factors, is what type of vehicle was it, which was the registration plate for the license, where was the vehicle licensed, driver, was the driver the registered owner or not the registered owner, what is the make, model of the vehicle, and there are codes for each of these, and type of the vehicle, two-wheeler versus a compact small car, mid-size car, station wagon, light pickup, so on. Year the vehicle was manufactured, the model year, and then this is what I told you yesterday. We have a unique identifier for every vehicle. It is called the VIN, vehicle identifier number, and we use it more than in safety. It's usually law enforcement officers use it to detect stolen vehicles, to try to identify them even if the license plate is changed. And the VIN is embedded in several parts on the vehicle, so that people cannot, thieves cannot cut and sell it that easily, on many main parts, the door, the frame, the engine block, so on and so forth. The VIN name. So they are breaking down the VIN into various blocks. We don't need it for our safety analysis. Was there a trailer involved? Most of the cases you will find no trailer. There are just a few that have trailers. I look at 1 or 2 trailers. 28 out of the 588 vehicles involved were towing a trailer. So the point I'm making is it's not very common. Jackknife, whether the vehicle jackknifed or not is the thing. Jackknife is when a vehicle goes off the road, and are you familiar with that? Could you explain it to the class in terms that people here may understand? You know, Ritvik works in the commercial area. If you'll use your microphone.
To understand jackknifing, it will be easier to understand if we take the concept of a collapsible knife, like the Swiss knife, or we use it even in our homes like a beetle cutter, right? Chaku, that are the one commonly thing. So if you have a trailer, it is mounted not directly on the tractor. It is mounted on something called a fifth wheel. Consider it like a bearing. So if you have something mounted on that bearing, like a cantilever, it can swivel. So what happens is, like, if you're on a highway and suddenly you brake, so the front vehicle will definitely stop. Second vehicle will not lose its momentum. So it will continue and it will transfer its energy either to the left or the right. And as a result, sometimes the entire trailer comes in front of the vehicle. So that's it's.
Very nice analogy. I wouldn't have thought about the Chaku analogy. That's a very nice one. Thank you. I'll try to keep that in mind when I speak to other audiences. So usually that happens when one of these vehicles that carry a trailer or hauling a trailer is going too fast, has to abruptly brake or abruptly sometimes swerve. Sometimes the back of the vehicle comes to the front, or it almost becomes a U-type. Then it was a jackknife, and then you have several fields related to that. What I will do is, while you work on the data, I will download, so whether it's a bus, so on and so forth, I'll download the data dictionary and share it with you. I think that is more efficient use of our time than for me to explain each of this. Rollover as the term, this is under override. So this is when you have a large profile vehicle and a smaller vehicle goes and crashes into the back of it. Think about a big truck or a lorry and a small car or a two-wheeler motorcycle that goes and hits at the back of it and goes under. Rollover is whether a vehicle rolled over. Impact, at what angle. So you look at 360 degrees of the wheel. So you can see 12 o'clock point, left, right. So it is not particularly deformity, and the description of deformity. Oh, come on. Whether a vehicle was towed or not towed, pedestrian involved or not, whether there was a fire. Oh, one thing now, additional feature that you get here, which you could have derived from other ways once you have the latitude and longitude. There we use the word zip code, which is the same as pin code. Here it's a 5-digit number. If you have the latitude and longitude, and you can overlay that on a map that has the zip code, pin code, and find it. But here they are explicitly identifying where the zip code is. Licensing status, 0 is not licensed, 6 is licensed, 9 is not known. And whether it is a commercial driver's license or not, whether there are endorsements. Some people have the license to drive multiple classes of vehicles. So these are very useful for us to evaluate who are the types of drivers who are being involved in such crashes. Then come the height, width, and weight of, I shouldn't say height, width, drivers. Let me skip the date. Speed related. This is another field that you might find of relevance. Was it due to excess speeding? You will see code number 3 is excess speeding. Traffic way is two-way unprotected median divided, two-way not divided with continuous left turn lane. So these have to do with the roadway geometry. How are the lanes configured? What is the posted speed limit or number of lanes? Posted speed limit. which direction of travel, straight. So type of roadway, surface, vehicle traffic control, come on. Let me skip on this and then go to the third one, which is your person data. Here the person one, for motor vehicle occupants, what I wanted to show you is it gives you information on exactly where each person, age and gender of the people involved in the crash, each person, where were they seated, driver, passenger, and their location. Injury severity for each person, 4 is fatal, 0 is no, and 1 is possible, 2 is minor, 3 is major injuries like we have seen before. Seating position, where did I see? And tells you front seat, left, center, so on and so forth. Were they using for a two-wheeler, were they using a helmet, what type of a helmet appropriate, were the airbags deployed, were anybody ejected, thrown out of the vehicle, were they wearing, was each person, for each person you have this information. Let me find one where I'll show you an ejection. Two is partially ejected, they were thrown off their seat but within the vehicle. Let me try to find. I could not find another one. This is, in some crashes they are so horrific that the people are not able to get out on their own, or the first responders are not able to pull them out without mechanical means. So extrication means that they have to either what we call jaws of life, they are huge shears or cutting things which cut open the vehicle to extricate the occupant. Whether or not the person was under the influence of alcohol, suspected, and how did they determine it, whether there was a test given and what type of test, drugs. So this is a lot more extensive. If I look at it, I think it goes all the way to field DV. I'm going to stop sharing this now. I'll start, I look at the time, it is 2:55. I will give you all, like yesterday, 20 minutes to do any analysis that you want on one or more of the sheets that I shared with you this afternoon. Please work in teams, teams of 2. I see there are 2 teams of 3. Please split yourself into 3 teams of 2. Okay. And those online, please work with your WhatsApp groups and do any analysis using these data. While you do that, I'm going to try and see if I can locate the FARS data dictionary. I'm going to unplug my computer so I can work on it for a little while. You decided to work 3+3, huh? Do you have your USB drive again? I will give you the data manual, so if you can share it with. If you can send on the same folder, I put a PDF file. Can you send it to all participants now? I gave it. I don't know what I'm thinking. I had ejected this. Yeah. 5 minutes to go, people. Oh, yeah. All right, people, 1 minute. All right, let's bring to a halt what you're doing. Quick question, I'm not going to make you report as I did yesterday. I want to see if any of you have anything that you found interesting that you'd like to share with the group. Hey, please stop your conversations. Let's pay attention here. Is there anybody here who wants to tell what you did or what you found? Yes, go ahead.
Yes, sir. So in our analysis, we found out that the total crashes occurred in most of the occurred in the four-door sedan cars. Four-door sedan cars,
yes.
and the total fatal crashes. Most of the fatal crashes occurs in the two-wheeler motorcycle. So we come up with.
Oh, that's a surprise to me.
Yeah.
Double check.
Yeah.
Double check your work, because I think motorcycle fatalities probably are less than 20 out of the 384.
No, sir. In our yeah, we have found it in the person. Sir, can I share my screen?
Yes.
Okay, sir. Just a second.
So I will need to do this.
No, sir. I am on,
Yeah,
in the
for
meeting.
that I need to connect this for you to share.
Oh, okay. No issue, sir. How to share it?
ये लोग अपना स्क्रीन शेयर करना चाहते हैं, तो इसमें कनेक्ट करना है ना?
Sir, it's done. I'm there.
It's there, yeah, but it's not coming here. Oh, they cannot see it.
Okay, fine.
So keep talking. Keep talking. So you may please enlarge the numbers.
Yeah. So, sir, as per our chart, sir, as you can see here, the four-door sedan has the most number of total number of injuries. Sir, here I'm sorry, the crashes, and the sir in two-wheeler motorcycle like this. This is here. Where is my cursor is? It has the total fatal injuries. It's more than the four-wheeler sedan or anything else.
I need to look at your analysis. I'll tell you a quick way.
Yeah.
Go back to the original sheet where you have the data.
Sir.
Just shift. This is your analysis. Where is the raw data?
Here it is, sir.
Person.
Sir, I'll just hide some of the.
Okay,
things,
so where is the vehicle type?
Yeah.
Okay, put a filter on row 1, highlight, just click here.
Okay.
Above 1, click there.
Yeah.
And go to data. Data, just data.
Okay. Yes, sir.
Filter.
Yes, sir.
Okay. And now click on this.
Oh, sir, my laptop just got dead. I have no idea what happened.
Power gaya. Is somebody going to come share? Those people online, are you able to see what Shanthan had shared? Online, were you able to see what we were discussing here?
Yeah, I think I just had one suggestion, like rather than getting the full vehicle types, they could have gone for top 5 or top 10 vehicles with the maximum number of fatalities. That would have been clearer.
Yes, I agree, but I gave you full license to do whatever you wanted to do.
Yeah, because on screen it's not visible, like it's quite cluttered for
Yes,
to discern what's.
Yeah. क्या हुआ? नो कल आपने किया था ये लेके इस पे कनेक्ट कर दिया तो उसमें भी आया.
प्रॉब्लम ये होगा कि कैमरा टीम्स में नहीं.
Okay, so परवाह नहीं, they are able to show it. Okay, Shanthan, is your computer back up? All right. Anyway, but
I think somehow we made our point.
okay. Does anybody else have to make any interesting observations? Online, Shruti, you had a comment about the current presentation. Do you have anything about yours? No. Okay, so there are many ways we can dissect it, but what I would suggest.
Yes, sir.
Yeah, you have some? Go ahead.
No, I have a similar observation. Like I merged the data quite late, but I used it doing Python. So most of the work which I did was similar to what we observed during our earlier works, which we did on the Nevada crash data set.
Okay.
One observation which I found really unique was like while calculating the descriptive analysis, there was like while distributing the fatality count per crash, I got there is average 1 fatality per crash. So the crash had certain level of high intensity if there is a fatality associated with it. Apart from that, the distribution of crashes by hour of the day, I observed the maximum number of crashes were occurring after 3 p.m. between 3 to 6, and then later at night around 9 p.m. there was a high crash count
Okay.
observed.
Thank you. So go
Sorry.
ahead.
Thank you. Yeah, then day by accidents distribution of crash with respect to week, I observed higher crashes were there during Saturday and Sunday, that is the weekends.
Yes.
As far as lighting conditions are considered, the crashes were most during dawn time, but like an outlier was there, like a very high number of fatality was observed during daylight. So that might be due to overspeeding. The reason needs to be explored for that. And Clark County had the highest number of crashes recorded. And as far as roadway type is considered, minor arterials had the highest number of crashes.
I'm sorry, Shruti, I missed what you said at the end. They are trying to help me with the IT. No, जैसे था वैसे ही छोड़ दीजिए. Yeah. So Shruti, what was the last comment?
Yeah, one unique observation which I felt was that the highest number of accident crashes were observed at minor arterials rather than high-speed interstate roads.
Okay. Thank you.
Thank you.
Okay, so I want to, so a few comments based upon what you just reported before that. So you reported a higher number of, first of all, you had at least one fatality per crash in the data you analyzed today. That is to be expected because the data that I shared with you were only for crashes that had at least one fatality, whereas yesterday's had those which had fatalities, so that may only have had A-type crashes. So that's not a surprise. I'm very happy to hear that you use Python to link or connect the data sets. So there are many ways to do that. I'll show you, since several of you asked to show how to connect or link different spreadsheets. I'll show you one way to do it in a little while. So I was trying to answer the question that Shointan and his group said, what type of vehicle. Give me 1 minute. Oh, by the way, I shared with you, Ritesh, were you able to share this file with them? So this is the FARS data users manual. This was published just last month, February of 2025, so it's brand new. And what I wanted to point out is I only showed you 3 different types of files: the accident file, vehicle file, and person file. There are many more, and if you look at it, there are about 600 pages just to document what it is. For example, if I go to the vehicle file, it gives you the code for what each field has. So unit type, vehicle type. So I don't want to belabor this, so please look at this to understand how rich the data set is, and you will also see that there are certain data fields that were collected from 1975 to 1980 or so, or some period of time, and discontinued. Others were not collected in the years past, but maybe in the more recent years were collected. One example has to do, I think in 2019, they started collecting some data about connected vehicles or in-vehicle technologies, but they stopped doing that after 3 years because they were not able to get reliable data. Professor Maurya was talking about some of the challenges getting the data, and all of this was dependent on what the police officer was recording. So you will see that there are some fields that they stopped collecting after 2 or 3 years. Let me go back to vehicle. Shantan, you were talking about this, right? Let me look at motorcycle. I'll take motor scooter. off-road motorcycle. Only three are scooters or off-road motorcycles, but I'll work with you to double check this. I was not convinced that you had correctly identified all of these. All-terrain vehicle. It's 3:30. So let me work through. What I see is one way to link two sheets that have the same field. What I'm going to do is I'm going to use yesterday's data set, what we did, because that's slightly smaller in size than what I just showed you here. There are many ways to do it. Several of you said you were using Python or other codes, so I'm not going to go into that. So this is the Nevada crash data set that I showed you yesterday. We have three sheets, the statewide, person and vehicle. So what I'm going to do here is I'm going to combine vehicle and I'm going to try to combine. I hope it works. Okay. Oftentimes you do it and then when you try to show how to do it, it doesn't work. I go to the data tab. So please follow me on the screen. If you let me enlarge this. Is there anybody online who is not able to see what I'm doing? I was here, I went to data. Okay. Click on data, you get the get data. I'm going to get data from, come on, an Excel workbook. Which is Excel workbook. I'm going to use the Nevada crash data. And I'm going to use the select multiple items because I want to merge two tables. To keep it simple, I'm just going to keep the person table and the vehicle table. I think we had 490 or so vehicles and 800 or so persons. So when I merge it, I should get around the 900, the sum of the two, not the sum of the two, the higher, the person one, but I should get all the fields that were in the vehicle field, vehicle sheet, and all the fields that were in the person field. So I'm selecting these two, and I'm going to say the bottom, load to. Where do I want to load to? I want to load to this particular point, existing worksheet. I want it as a table in a new worksheet, or it created a new worksheet, I'm sorry. So you can see there are 717 persons, 498. So it's still loading. Why did it not? Oh, I should have done combine queries. What I did was individual queries. I'm merging the two. Oops, I have to, pardon me. It has to allow me to select the field. I'm going to redo it. I told you when I try to do it, I might not do it correctly. Get data from file, Excel workbook. Oh, that's not what I want. So when I combine queries, it is asking me which table. I'm going to first go to the vehicle table, and which column do I want? This is the column, the first column, which has a crash number, right? Is there anybody who's not following me? Next, I go to the person table.
Hello.
Yes?
Sir, can you just repeat from the beginning?
Start from the very beginning. Okay. Let me just finish this particular step, then I will go back. All right?
Okay, okay, sir. Thank you, sir.
You're welcome. So I selected which sheet I wanted, and this is the field. And let me click OK. Let me see what it does. So you can see it has all the fields from both the sheets. Oh, I'm glad I went here. Person table, it did not. When you look here, the person table is just as person table. It has not expanded the fields there. But if I click, come on that, I want the whole, not just the table, I want all the fields. I want to select all the fields from there and click OK. Now it will populate. So all the fields that we had in the vehicle table, all the fields that we had in the person table, and if I did everything right, I should have 790. Oh, come on. Let me go. I'm going to hit the load and close. I'm going to, it will save it as a sheet. I'm not sure what I did incorrectly. It merged both and then did something. I don't know why I got 1400, whereas I should have had only 717 rows. It doubled it basically. I did it twice, 717 plus 717. Right. So Chandrika Verma, you had wanted me to repeat it, right?
Yes, sir. Just would like to know the procedure to how to combine those, like how you did.
It is correct. Oh, really? Okay. So then, so if we add it, it comes out correctly. Thank you. Thank you for verifying it. So let me try this one more time. I'm going to save this. I'm going to open a new file so that it will delete all the queries that I had. So the data that I'm working on, oops, I saved it as the same file name. So I'm just creating a new file name for this. I want to show you that I'm using the same data and I'm creating a new sheet. So we had the statewide crash data, the person table and the vehicle table. Is there anybody who is not with me on what I'm just showing you? Chandrika Prasad, are you with me?
Yes, sir. Following, sir. Following.
Okay, so I'm creating a new sheet called vehicle plus person because I want to combine vehicle data and person data. And I'm just going to cell A1 or 1A and I'm going to click on the data tab at the top. Are you with me? I need to hear yes.
Yes, sir.
Okay.
Yes, sir. Yes, sir.
Every
Yes, sir.
time I
Yes,
ask,
sir.
every time I ask, are you with me, Chandrika Verma? I'm going to ask you to say yes or no. Okay.
Okay, sir. Okay, sir.
So I clicked on the data link, and then on the left, the way I have set up my computer, it shows up here. You click on the get data. All right, and I am going to query options. Let me see if I have to merge queries. I clicked on the merge query. Did you follow me on that?
Yes, sir.
And
Yes,
then,
sir.
And then so it is asking me what do I want to merge. So the first one I want to merge is the vehicle. I'm going to pick vehicle first because that has fewer number. Well, I'll pick person. And what is the column that has the common field between the person field and the vehicle field? That's the crash number, right? Are you with me?
Yes, sir. Yes, sir.
So I clicked on that field. Then I go to which is the second sheet I want to merge. The first one was person, so the second one is vehicle. And there too it is asking me which field to use to combine the two. So I picked again the crash number. Are you still with me?
Yes.
Excellent.
Yes, sir.
And from that I'm just going to click OK. Just working on it. And now I'm going to close and load. So basically it will save it. Right now it is in a query format. All of this is a query format, and you can see the coding. We didn't have to write any of the coding in the formula when we use this inbuilt functions. So here I'm going to go to load and close, and I'm going to load and close because I'm saving it right there. If you say load and close to, you can change the file name and save it somewhere else in a different file or different folder. So I'm just going to load and close. Jadoo chalna hai. Come on, come on, come on, come on. I don't like the default table coloring, so I'm just going to go here. So let me see what it did. 718, right? Because we had 718. But what I forgot to do is expand the yeah, it has combined all the fields. Last time it was when I did it, I went one extra step where it had all the fields on the source, the original merge table, and the second table was all collapsed. So when you are doing the query, go to that last column where it has got all the collapsed columns for the second sheet. Click on that, expand it just to be doubly sure. I skipped that step out here. Chandrikant Verma, are you okay now?
Yes, sir.
Okay. So hopefully this will help you all to combine sheets. The challenge is when you have more than a few hundred records, if you do this on an Excel file in this manner, unless you have a lot of memory to run the calculations, it may take a long time and you need storage space. So I prefer tools or techniques that some of you said you wrote an API outside or you used some other script to do the analysis outside of this. Yet other tools that I've had my students do is use R as statistical software. If you have used R, it is very easy in R to merge multiple data sets. So what I just did here was 2 sheets that had about 900 fields, but if you have 900 rows and about 70 columns. The FARS data that I just showed you today is far more expansive. So doing it in Excel may not be the most efficient way. If you have relatively small data sets, you can do it in Excel. Okay? During the break I will try to help you. So what if we do one thing? May I take a break now? I don't know if the chai is ready, and those of you who are online, you get a break and then we can reconvene. We can reconvene now. The time is 3:45. We can reconvene at 4:15. That is do we have a 30-minute break in the afternoon, or do you want to keep it shorter? 20 minutes, okay. We'll reconvene at 4:05. That is IST for Indian Standard Time, not Indian Stretchable Time. All right. People online, are you able to hear me? People online, are you able to hear me?
Yes, sir.
Okay, thank you.
Yes, sir.
So I was playing some music here. No, that's mine. Yeah, thank you. Thank you. Yeah. It is. So I'm sorry about the delayed start once again. Our chai was not ready. I don't know if you had chai on time wherever you are. And the music, I tried to play music, so this was just a random what I asked Professor Google to find Hindi music related to travel. This is the playlist that they gave. Any questions, comments before I move to the next part? I have about 25 slides that I need to discuss with you. This is a continuation of what we did. Questions? Comments? Okay, I have a question for all of you. Specifically, this was to address the feedback I had is, please show us how to merge the data sets. Was that clear enough to figure out at least basically how to merge the data sets? I see some nodding heads in the room, but I cannot see any of you online. So please respond audibly. No, okay. So to build on what we discussed earlier today, I want to pick up on how to estimate what might be crashes or safety improvements that we could derive from different interventions. So that's where we came about with the crash reduction factors or safety performance functions. Now how do we model it? Over the last 3 days, we have looked at many variables that relate to safety outcomes. Many of the times what we have looked at is it is correlations of factors. So far we have not looked at straight causality. Is a certain input causing a change? In order to prove that, we have to use statistical methods to say, yes, this is either positively or negatively affecting the outcomes. As I mentioned earlier, I am not going to go into deep mathematical formulations. The next 7 or 8 slides, I will quickly go over different mathematical approaches. I know most of you are in the MTech, MS or PhD programs, or a few of you are working. There may be a few of you who are undergraduate students. It's for the postgraduate students and PhD students. If you're not already doing it, it is something for you to consider if safety is an area. For undergraduate students, it's something for you to be aware of as how might we model, we come up with tools to estimate outcomes. And the outcomes, once again, I want to make sure you understand there are multiple ways to characterize outcomes. One is the frequency or counts, total number of crashes. The first example I used this morning, 1000 crashes versus 1020 crashes, 1000 outcomes, injuries, fatalities, 1020. The next is break it down by severity. So many fatal, so many A-types, so many. So, but these are still counts. Professor Maurya also showed earlier today how do you look at that, how do you do a heat map, how do you do the black spot analysis where you have a concentration. But by looking at counts, we are not accounting for exposure. We have to look at vehicle kilometers of travel or vehicle miles of travel, and I gave you examples of the same too. 10 crashes versus 20 crashes or 10 fatalities versus 20 fatalities. You cannot compare it that way. It may be 10 fatalities per 1 million vehicle kilometers, 20 fatalities per 10 million vehicle kilometers. So look at the rate. Yet other ways, I showed you these in charts over the last 2 days, is proportions, fraction. What fraction of the total crashes in this area are fatal or fatal and A-type? How about in another area? So now we are looking at percentages. The reason I bring these up are some are discrete variables such as counts 1, 2, 3, or you may say less than 10, 11 to 20, so on. Others may be continuous variables when we look at rates. X crashes or X fatalities per vehicle miles of travel or per population per registered vehicle. When you look at fractions or proportions, that's different. So the types of statistical analysis we do will be dependent upon the type of variables we have. Whether it is the dependent variable that is on the left hand side, y equal to a1x plus b1x so on, or if we could have a combination, some variables that we use on the right hand side of the equation could be discrete, others could be continuous. How do you mix and match that? Some may have values that range from 0 to million, others may have values that range from 0 to 10. And if you use both of them in the same model, it may not give you the appropriate levels of significance. So how do we normalize that? Sometimes what we do is we normalize it saying this is 100, and if it is above average you will have 101, 102, 110, 200 so on. If it is below average it is. So now everything you can use on a scale of let us say 50 to 200 or 100, 0 to 200. You are not having a scale where you have on the one hand variables have values of a million, on the other hand you have variables that have values of 100. Is there anybody who didn't understand these comments? Online? Okay. So keep these in mind. So what models are appropriate, what statistical tests are appropriate, and we often assume that data are normally distributed. That's not necessarily the case. When they are normally distributed, we use parametric analysis. When they are not normally distributed or we cannot prove that they are normally distributed, you have to use what are called non-parametric approaches. So here what I have shown is one way to look at the dependent variable is the expected number of crashes as a function of traffic volume, roadway characteristics so on. And the example I have here, the first one here on highway segments, the number of crashes is AADT or ADT, which is a traffic volume raised to some exponent times e raised to b01 beta 0 beta 1 x1 beta 2 x2 so on. So now the x1 x2 are other variables, such as it could be the number of registered vehicles, number of people living there, number of vehicle kilometers of travel. It could be number of policemen per 100 miles of roadway, 100 central line. As long as there is a reasonable causality, it may come out that in your modeling it says this variable is not significant. I don't know if it was Dr. Bharadwaj or Professor Maurya had shown some modeling examples where it showed some variables were very, very significant. There were other variables that had p values of 0.56 and so on. I think it was you, right, Doctor? Yeah. So pay attention to that. The second one is intersections. Now what you see here are the volume on the major street times the volume on the minor streets times another set of variables. For intersections, what is interesting is how many cross trajectories are there. That's why you're using the volumes of major and volumes of minor street. Here are two models or two charts that show. The first one on the left is for safety performance functions for multi-vehicle on rural 4-lane highways. So this is multi-vehicle, this is single vehicle. I highlighted it in red. So note that these are very, very different. So now you have the predicted crash frequency versus traffic volumes. You see this one is exponential curving up where you have multi vehicles, whereas on single vehicle it's curving the other way. These are based upon actual observed data. This morning I think it was Ritvik who asked, how do you come up with this SPF? It is based upon many dozens or hundreds of observations, and here is an illustration of all the observations. Now these are things I touched upon earlier in the last 2 days. Other than what is reactive, when we look at crashes and so on, we are responding to what has happened. How might we look at the other things on the pyramid? Remember the safety, there are trillions of safe passages, there are billions of passages where you have some evasive maneuver. So near miss is heartbreaking. So we can look at it as somebody sitting on the roadside or at an elevated spot making a record of that. But with today's technology, we can use cameras to detect that and computer vision to decipher what is it. But more importantly, or more increasingly, what we are using are mobile phones and capturing that, or other forms of sensors that are either built into the vehicle by the original equipment manufacturer or add-ons. Particularly in corporate fleets, such as maybe a company has many Uber vehicles or taxis, a company has many delivery vans, Amazon or whoever it is, or it may be a trucking company who have hundreds of vehicles on. They can instrument their vehicles with other sensors too. So getting data today is a lot easier than even 10 years ago. 10 years ago was a lot easier than 20 years ago. 20 years ago was a lot easier than before. So it's the eases, the quantity of data per cost is going up exponentially that we can get. Now how do you derive meaningful inferences from this? But we cannot get away from other types of data, such as we do need to have intercepts, talk to people or do online surveys to get what is called stated preferences. How do people behave, or how do they respond to various things? Other ways are, I heard somebody saying simulators, that you work with simulation. Put people in a simulated environment and observe what they actually do. So I do not want to discount the value of such data gathering techniques. Yet others are the safety culture indicators, whether it is within an organization. If the superintendent who oversees all the drivers is very strict about enforcing, you will never exceed the speed limit is the company's policy, and they have sensors that get data, and there are each of these companies, I shouldn't say each, many of these companies in the United States monitor every driver every trip. It's not that there somebody's looking at them and all the time, but they set thresholds of if the driver exceeds a certain speed or certain acceleration, immediately that is recorded, and at the end of the day or end of the hour or whatever it is, the supervisor sees on a dashboard by driver, by collection of drivers, by location, so on and so forth. So if the supervisor is very strict, saying that you will not exceed the speed limit, and they hold accountable the drivers who exceed the speed limits. I don't know what holding accountable is, maybe reducing the amount of time they work or penalties work. That's going to drive the organizational culture, saying that we must obey the laws this way. Compare it to another organization where they say, oh chalta hai, they are not going to enforce it. That reinforces the behavior, and oh, it's okay, my supervisor. That's the company. But social is within a neighborhood, within our organization, within our peers. If each of us says, I will not be in a vehicle if that is going to move if everybody doesn't wear a seat belt, you're now pressuring others to do that. There was another example. Oh, other gross indicators are, you look at a neighborhood and the prevalence of adverse safety outcomes in terms of crashes that involve pedestrians or vulnerable road users. If it is within the colony or community, let's say the IIT campus here, IIT Guwahati campus, almost all the users are residents here. There may be a few who are vendors or some employees who live outside and come here, but a vast majority of the travel is here. And if we see repeated close misses or repeated crashes that involve vehicles or vulnerable road users, that means the culture here is too lenient and allowing this. Whereas, oh, over the last 2 years or 3 years, this has come down. That means something is changing here, and people around are less tolerant of violations, are less tolerant of people taking safety risks, or less tolerant of people putting others at risk, not just themselves. I gave you an example the other day about credit scores. That gives you broad indications of how people behave. If they behave in one way with their money, they are willing to take. There are studies that have shown that there are close correlations with traffic safety outcomes. Daniel, you had your hand up? Okay, scratching your head. Okay. Yes, Ritesh?
Sir, actually about credit card actually we are talking about.
What was that?
It's a credit card.
What about credit card?
Sir, while using credit card actually our CIBIL score decreases.
It may or it may not. I don't know how it is monitored here. I know in the US, if you use your credit card responsibly, it will go up. And if you apply for a new credit card or new credit, whether it is a loan to buy a bicycle or to buy a motorcycle or whatever it is, there is usually a dip when you take dip in your whatever that score is. But then as you continue to be a responsible user, the score goes up. So these are some of the things that we don't see traditionally. That's what I meant by emerging. Yes, Ritesh?
Yes, sir. As we know that traffic safety should be the proactive approach.
Yeah.
So when we are talking about the near misses and heartbreaking, so can you talk little about the surrogate safety indicator thresholds, like in the heterogeneous condition, and when we will move to the homogeneous situation, like how we can talk about that?
I don't think I'm an expert in the heterogeneous traffic conditions that we see in India. There are many ways to look at it. I will comment on it briefly and then come back later because I want to touch upon it. One big thing is, what is the societal acceptance? Here, when I am driving, or I haven't driven in India in 40 years, okay? And even when I drive outside of campus environments, I'm almost closing my eyes because here I can see people driving and you put your finger out, maybe you'll touch the car next to you, okay? In the US, if you come within 2 meters of the car next to you, so it is not accepted there, whereas the smaller gaps are accepted. I'll give you 2 examples that I have had many of my colleagues who are from the US, born and brought up there, who lived there, no Deshi connection otherwise, no connection to India. One of them has come here many times, one came once. So their observations. One is we went in an auto rickshaw once. His observation was that the auto rickshaw driver thinks that if the front wheel can go in a little space, the whole vehicle will go in that space. Whereas in the US, that is not acceptable behavior, okay? You need to make sure you have enough space and a cushion around you. The other person said that after driving here, lane discipline, heterogeneous, you've got so many vehicles all over the place, and the attitude is let and let live. It's not hit and get hit, okay? People are aggressive, they are willing to take very short gaps, time gaps or space gaps. Whereas that is not the case in the US. Yet other things are, for most urban roads in India, the operating speeds are less than 50 kilometers an hour, maybe even less than 40 kilometers an hour when you have traffic jams. Whereas in the US, even on urban roads, maybe there are a few hours where it is less than 40 miles an hour, which is 60 kilometers an hour. So as speeds increase, if you have an incident, adverse safety, the consequences are much greater. As speeds increase within the same reaction time of 2 seconds or 2.5 seconds, the distance you travel is much greater. That's why you need more gap, whereas in the Indian condition. So to set the thresholds, it depends on what may be appropriate in a tier 2 city like Guwahati may not be appropriate in Bangalore or Delhi. So you have to set those thresholds accordingly. This is as best as I can answer your question. The other comment that one of my other American colleagues made is, people in India drive, if there is lane marking, there's no lane marking many times, they use the lane. Is there anybody who has not been on an airplane? Okay. They use the lane markings like the airplanes use it as a runway center line. So the vehicles want to straddle the lane marking and go. So what are the different types of families or classes of models? You have regression models, where you have Poisson, a negative binomial regression. logistic regression, especially when you have discrete variables or discrete outcomes. And so that's where binary, whether you're likely to have a crash or no crash. And then there are negative binomial. I've given you an example. It's exponential of some linear or non-linear. The beta 1 average daily traffic, beta 2 lane width, beta 3 shoulder width. This looks like a linear. It doesn't have to be linear. It depends upon how you envision a variable is. Again, part of it also depends upon, I told you, some variables may have range of values from 0 to a million, others may have 0 to 100. So how you account for it? Just like you may use log scales in certain other things. There are ways to mix and match. Just be aware of it. We don't have time in this course to go into it. I just want you to be aware of that. Base models. So a lot of the crash modification factors and so on are based upon if this then that. These are conditional probabilities that we are using. Okay. So you need to incorporate prior knowledge, or these models incorporate prior knowledge to build in, say, okay, over the years we've had these. So this another strategy, and I just have one of my PhD students is looking at a new way, is using some of the Markov chain tools. That is also a chaining of what has happened before to try to figure out what will happen next. That may be particularly suitable for time series types of analysis when you're looking at large data over a large period of time. When I say large period of time, it could be 365 days where one day is thing, but in our case that's not necessarily the case. We are looking at many years or many months. I think in the feedback that I received from last night, a few of you asked to comment about AI and machine learning techniques. While I'm familiar with them, I'm not an expert in that. I partner with other colleagues who have that expertise. I bring the transportation safety data background. They bring the machine learning, AI, natural language processing type backgrounds. So we work together. So I don't have enough. If you ask me to describe the details, I do not have that expertise. But I'll tell you a couple of the examples that I've got. Is one project that I'm working on has to do with the narrative that is written at the end of challans. I believe I have talked to you about this briefly earlier. So these narratives could be as short as 20 to 30 words to maybe 150 to 200 words. We are a lot more fortunate in the US that all the narratives are written in English. Professor Maurya showed examples where it was written in Hindi or written in Bengali or other languages. So yes, we can use other techniques. It used to be pattern recognition, character recognition tools, but now I think AI models can do it better. But talking about English, it is very hard for an analyst to look at, we have 40,000 crashes a year in Nevada. If you had to even spend 3 or 4 minutes reading the narrative and then explaining it, you're looking at 5 minutes to 10 minutes per thing. So that's 400,000 minutes. It's very, very labor intensive. So maybe you have multiple people, then you have variability across people. So what we are doing is, my colleague's name is Professor Ji Woong Park. He and another postdoctoral researcher and I were working on looking at strings of words. What if we take 2 consecutive words? What if we take 3 consecutive words? What if we take 5 consecutive words? Can we discern things? And some cases it is just by looking 1 or 2 words, they may say alcohol in the narrative. Alcohol, it may be that there were bottles of alcohol that were sealed in the car. It was not that the person was under the influence of alcohol. So you need to read it. So, and what we are trying to figure out is, one, what is the precision that we can have, and he's using so many different models. And how many words do you need to have a reasonable amount of precision? There's a trade-off between the computational power, the time that you need if you're going to look at 8 words every time. So just like we talked about dynamic segmentation this way, you look at word 1 to word 8, then word 2 to word 9, word 3 to word 10. That's very intensive if you want to go to 8 words, whereas if I am going to look at 4 words at a time, it is computationally less challenging. So, these are some of the things that we are doing, and looking at the use of natural language processing. And other part that we are doing is to try to minimize the time that a police officer needs to spend in writing up either a challan or a crash report. Every minute the police officer is on the road, the police officer herself or himself is at a risk of being hit by other vehicles. Yes, they stand around the vehicles, but there are so many secondary crashes. And every time the police vehicle is there, we have the lights that are, it's a distraction to the other motorists. Not only there are potentials for secondary crashes, but that is a reduction in capacity. People slow down or their behavior changes. So, our goal is to reduce the time that it required to properly document either a challan or a crash report. So, what we are trying to do is, in addition to what has been done in Nevada and other states where we have electronic devices, usually computers or tablets, is have the officer speak and voice recognition. Now, what we have there is a lot more homogeneous, just like traffic is homogeneous there compared to here, but even there is variability. We have different accents. We have where we live in Las Vegas, Nevada, we have a substantial portion of Spanish speaking population from South and Central America. Their diction is different, and they serve in our law enforcement. Then we have immigrants from so many parts of the world there. So, what we are doing is using 10 students who have different backgrounds to speak and trying to train the model to recognize different accents. Then we are giving it to the police officers and say, hey, can you have a mix of your representative mix of your people, and when they speak we also record that. What is the computer saying they said, and then somebody, it's a manually intensive thing. How accurately are we capturing that? So, that's a totally different thing that I am not trained in, but I have the expertise from the safety side to make sure that if it makes sense. So, these are some of the evolving tools and techniques, and I think in the Indian context with IRAD, and especially where you showed the narrative of the challan, just like India went from the landlines where it was very less than 1 or 2% of the population had access to a phone in the mid 1990s to 2010, 2000, about 15 years. Better than 50% of the population had a mobile phone, and by 2020 I would say better than 85-90% of the population has not just a mobile phone but a smartphone. So, in capturing the data, you are talking about the challenges. Can we use some of these tools and techniques? Have the person dictate it, and now we can customize it. If it is in Bengal, maybe they are more comfortable speaking in Bengali and capture that in Bengali, and then Google Translate will help you do that. There are lots of other things. I don't own stock in Google, okay, I am not promoting Google, I am just using that as an example. Think about those things to leverage, just like we leapfrog from landline to mobile phone and the UPI payment. Not everybody had a bank account, check, so on and so forth. I think it is possible in the safety domain for the country here, based on each state's variations across states, to adapt and adopt such tools and techniques. Others, we talked about simulation, and digital twins are gaining great amount of momentum, but mostly in looking at the machine, and perhaps the machine to roadway or traffic signal interactions. When it comes to human behavior, it is very hard to clone each one of us and our behaviors. How I behave at 8 a.m. in the morning for a certain stimulus may be very different from how I behave at 6 p.m. when I am on my way home after work. The same stimulus, I might have a different response, and one of my colleagues talked about that in terms of the mental emotional state that we have. So, I think the digital twins are less likely from our operations perspective, but more so from a vehicle design, vehicle use and interaction when we look at the connected automated vehicles and infrastructure systems, that pairing. Daniel asked me about electric vehicles and the infrastructure for electric vehicles. I think that's another domain where we may be able to capture some of these behaviors, more so from an electrical engineering perspective, the charging behaviors and so on. Spatial analysis, I think we've talked quite a bit about this. I talked about it. Professor Maurya showed examples of hotspots, of heat maps, and one thing that I worked on maybe 6-7 years ago when I was at Tennessee. If you look up my publications, we had a few publications that use geographically weighted regression. So you give different weightage, just like we said, different weight for fatal crashes, different weight for major injury, different weight for minor injury, based on geography. Can we have different weightages? Urban rural is a simple example, but it could be by pin code, but it could be by panchayat, it could be by municipality. There are differences across. How do you take that into account? The key there would be, how do you come up with the weight? We can say, hey, we can use different weights. How do you come up with a reasonable way to say this is the weight that you need to give for geography area 1 versus 2 versus 3? So where do we use these? Where do we want to make improvements to the infrastructure, whether it is a hard infrastructure such as a roadway, lane width, shoulder, absence of shoulder, median, edges of pavement, so on. That's one. Traffic signal control, traffic control, signals, signs, markings. Targeted interventions are more so from the enforcement side and to some extent education to bring about behavioral changes. Both. Education, we know certain areas are more risk prone or people exhibit greater risky behavior. I'm not talking about going to your neighborhood, going to your neighborhood, going to your neighborhood and talking about. But I think Professor Maurya was the one who told. You're entering a high risk, a high crash zone. So education, maybe you just put up signs that accident prone zone or crash prone zone. So you're alerting the motorists. Okay. We could have variable message sign that it is only active in certain times. So education just doesn't mean that you interact with a specific geographic group of users or a school or so on.
No, I will elucidate. Can I elucidate a little?
Yeah.
So basically, if you go from Bangalore to Chennai,
yes,
on that highway, it is barricaded. No cows, no animals, which means no human beings can enter the highway. But many highways are not built like that.
Yes.
And they have been built over what you call rural areas.
Correct.
So they have no idea. For them, I used to cross the road yesterday, so will I cross today also. So here, if human intervention is not arrested, it will lead to more and more of these unintended events.
Yes.
So here, the only thing is enforcement.
Enforcement is the first thing would be education. Work with the village head or the gram panchayat or the gram council to let people know, yes, this is how you used to do it. Now you need to change behavior. Okay. Consequences are great, and unfortunately, sometimes people only realize when it hits close to home, maybe too late. Enforcement, but can you have police over the 300-kilometer stretch? Chennai, I think that's about 300 kilometers, right? Chennai to Bangalore or Bangalore to Chennai? Yeah. I know it is barricaded, you said, but think about a parallel one in a rural setting. It's impractical to have police there. It must be self-enforced there. People impressing upon their neighbors, their friends, their relatives saying, no, we shouldn't do that. But then it all becomes a matter of convenience. Hey, I used to cross here. Now if I have to go from here to there, I have to go half a kilometer that way, cross there, and half a kilometer this way. That's 1 kilometer extra. And a lot of those people are walking or bicycling or pushing something. That is a tremendous barrier. So from an engineering design perspective, can we provide them an alternative way to cross? Underpasses, bridges, but there are some social behavioral issues. What I understand is in urban areas where you have subways, there are acts of mischief that go on in the subways. So they prefer elevated things where it may be better lit or better exposed. So there are other unintended consequences. I think we have discussed many of these earlier. I just want to recap. Thing that I haven't talked specifically is the roadside hazards. Professor Maurya mentioned a little bit of that, the clear zones, safe zones on either side of the roadway. He showed examples of the chevrons, or how much space do you have where before you have the guardrail, or if you have a curve where you have lots of run off the road crashes, how might you provide additional shoulder. Not to have very rigid objects within the clear zone. Unfortunately in India, as I travel on road, I see lots and lots of, I think he had several photos that have these stone markers. They're very dangerous if you look at. And going back centuries ago, the emperors who ruled across India, they did some very nice things, things that with very good intentions. They planted trees on either side. The Grand Trunk Road is an example, to provide shade. But if you look at the trees, they are very, very rigid objects. If a vehicle goes and hits them, all the momentum is going to be absorbed, energy is going to be absorbed by the vehicle, not the tree. Okay, the trees probably, some may break if it's small, but when you have a 100-year-old tree. So we need to move away from that, and that's a lot of investment we need to make in the clear zones. And in much of the developed worlds or high income countries, we are required to have breakaway signs. The breakaway sign is even a traffic signal that is very heavy mounted, and we may have a cross arm that is about 30 meters long, 90 to 100 feet, 5-6 lanes. They're very, very heavy. But where you're mounting it at the base, you look at it closely, there are 4 bolts. Or if you're looking at a stop sign, speed limit sign, there's if something hits it at more than 10 kilometers an hour, the sign will break. So what happens is the energy is not absorbed by the vehicle that strikes it. It will slow down the vehicle. So when you do that, the occupants of the vehicle are less prone to injuries, or more so the internal body injuries to internal organs. But what we have in India is counter to this. We have lots of trees. We have lots and lots and lots of these stone or metal rigid things, ostensibly to keep vehicles from going away from the roadway. But even there, you look at the gap spacing between these stone markers that you have marked with black and white. Sometimes, to me, it's my personal observation. Okay, people are doing it because they said, "Oh, we need to put markers, so laga de." He gave a very good example. Oh, we need to put 6 signs, so put them all 10 feet away from each other. Not that you need to put it around the curve. It's just checking, tick mark a box. We need to do this, so we are doing this. But then it is incumbent upon us as engineers, as planners who have a lot more knowledge about this, to tell the layperson who the contractor is employing laborers who don't have an engineering degree as to why and where what it is. That's why detailed drawings are important for the field. And post construction field inspection to make sure what was designed was what was done. So just a quick digression here. Let me look at the time. Yeah, another 15 minutes I should be done. I'm sorry. We have until 5 or 5:30. No, I'll try to cut it short. A simple example. When I was at Iowa State University, director of an institute there, we had one center within the institute that was the Concrete Pavement Technology Center, the National Center for Concrete Pavements. And they did a lot in terms of what concrete mix you should have, so on and so forth, and come up with very precise designs. And the director of that used to be the chief engineer of the State Highway Department. At one meeting we were talking about some things, and he said, you know, we can come up with all of this. Who is the one who is placing the concrete in the field? It is one of the contract workers. That person probably has a high school education or so. They say, oh, this mix is so stiff, so let's pour 2 more buckets of water. It makes it easier to work with, right? Otherwise the concrete is so stiff, it is very hard for them to vibrate or spread it. And that worker's attitude is, I want to make it easy for me to work. So no matter all the science and engineering that went behind to come up with this design that was so perfect, saying this is the water, cement, sand, aggregate mix. It's all gone out the window because the construction worker said it is too hard to work with that mix. Dal do thoda aur pani. So think about who it is who's helping you deploy your design, construct your design. How do you inform them? How do you work with them? And let's not be condescending. Help them understand why it is. So next time you don't have to spend so much time. Don't say you do it because I told you to do it. You do it because these are the reasons to do it. So then they will start owning it and thinking about it, owning it. So next time they will take pride. Sir, aapne dekha kya main kaise kiya? They have a lot more pride in doing what they do. Let me go on. Operational factors. One thing that I haven't talked about previously is driveway and median openings. The example you gave from Bangalore to Chennai, where you have barricaded, that's what we call freeways. You can only get on or off at restricted points of access or egress, on ramp and off ramp. But here across India, even on national highways, we see so many points where you may have a frontage road or access road, and then every now and then you will see somebody coming. And you have vehicles that are traveling at 80, 90 kilometers an hour, and all of a sudden you see somebody with a little donkey cart that is coming onto the roadway with a speed, operating speed of 5 kilometers, 10 kilometers an hour. It's hard to avoid that. So how do we educate that or minimize that? In the US, that's a big problem in urban areas, because every business owner wants to have a driveway to enter their parking lot from a high-speed road. Their thing is, if I make it easy for people to come into my parking lot, I'll get more business. I make it more difficult, I'm going to have fewer people. The last point here, human-machine interface, vehicle controls in vehicle systems, is something I want to spend just a few seconds. I talked about this early on yesterday in terms of the more you get to used to certain things, the more you start taking things for granted. That can lead to complacence. That's one. The other thing is, the modern automobile has a command and control center that's more of an infotainment system than just the olden vehicles. Well, you have on the dashboard 2 or 3 dials. That's all. Now you're driving, I want to change the channel of the music, okay, or I want to make a phone call, or on my screen I see SMS, so on and so forth, lots of things. That causes a lot of distraction. The focus is not on driving, it is on what is on the console, what do I need to do. So that is some of the downsides of some of the in-vehicle systems. However, there are lots and lots of positive benefits of these in-vehicle systems. We've talked about the lane keep assist, okay, lane departure warnings, forward collision avoidance systems, rear collision avoidance systems. Even when you're backing up, sometimes if you have somebody going in newer cars, you get a beep or a sign. You have multiple blind spot detection systems in the newer vehicles, that under your side view mirror or on your dashboard you can see a blink or something saying that there's a vehicle in your blind spot. When you're changing lanes, don't do that. Environmental factors, there's very little that we can do to control the environment, but there are a lot of things that we can do to educate the road users about how to handle these things. Maybe better lighting if you have lots of dark, crashes during the night time, or under wet conditions, can you design the roadway better so that you drain the water off the roadway. Work zone, I put that under environmental. We need to educate our road users, and that's a place where more enforcement is easier to do. If they violate the speed limit that is posted in the work zone, give them a hard challan. I say that, it's easy for me to say. Even in Nevada where I live, we cannot have automated enforcement.
Sir, I have a question.
Yes.
Oh, people are violating the rules, then why we can't do speed limitation in like vehicles only? Like we start to make like that maximum speed of is 150 only. Why we are giving 300 kilometer speed limit? If we know that the safe limit is 120 or 130 maximum, we are saying we are going in freeways also if we are using, we have to use 120, not more than that.
I agree with you wholeheartedly. I think that is something where we need to work with our elected officials, our appointed officials, regulators to come up with this. Most vehicle manufacturers use that as a marketing tool. You can go from 0 to 90 kilometers an hour in 2 seconds, in 3 seconds. Oh, look at this, my vehicle can allow you, it's got so many horsepower, you can drive at 180 kilometers an hour, 200. How often are you able to do that? I wish we manufactured vehicles that did not have the capability to go greater than what you are saying, whether it is 100 kilometers or 150, maybe what you have is 140, 150 kilometers an hour, but speed regulators that will not allow the driver to operate greater than a certain speed based upon the context where they're driving, when they're driving. Yes.
I can add one more. See, basically regulation also plays a lot over here. So in Europe, you have the low, no horn, low vehicle zones, low speed zones.
Yes.
So for example, if you're approaching the hospitals and education centers, not only it is, first of all, you cannot honk, you are immediately fined. And I want to talk about the technology. There is a zone technology. So you know about geofencing, right?
Yes.
So now geofencing has gone to the levels of, you can create.
Can you speak closer to the microphone? Yeah. Yeah.
Hello.
Yeah. Move closer to the microphone.
Yeah. So I was talking about geofencing. Basically now OEMs provide the government all the services to zone your vehicle.
Yes.
And then categorize the zones into speed limits. So you are assigned. Okay, so the vehicle knows that it is going into that zone and it simply cannot exceed that limit.
Yeah.
So those technologies are available now. I mean, it's a matter of, again, regulation versus value of life versus cost.
Yes.
So, I mean, we cannot expect everything to happen in all parts of the world, but technology is available.
I agree with you. And tomorrow I will talk about, for a few minutes, about how all of these come together. Okay. I agree with you 100%. There's technology available, but is there a willingness to adopt it?
Sir, I want to say one thing. I've seen a movie.
You haven't talked the last 2 days and now you are full of chatter. I'm so happy to hear the comments. Thank you.
Sir, I have seen a movie in that Tesla cars were there and there was a cyber attack for some war, and in that it happens to they hack all the cars and crash started happening. So in that I want to say and a family was there who had a manual car and they are trying to save their lives. So I want to say that there is a technology, I can say that, but if there is, like I said, if there is a limit in, initially we are not going to build a 300 kilometer per hour speed, we have 150 or 120 we will build. There is a chance of we can escape if in future also such type of cyber attacks also happen, if we are looking for like fully automated vehicles in future. So this can be possible, some cyber attack will happen, and how we are going to get saved. So if there is a speed limitation in starting only, we have some time to control it or manually.
Yeah, you have very valid points and I agree with you once again. This is something I alluded to earlier, I can't remember, yesterday or so. Concerns related to vulnerability of our physical infrastructure, that is the traffic control signs, vehicles, from cyber attacks or intrusion or insertion of even a bad package of information as we go to more and more of the CAVIS domain. There was a very nice example, if you ask Professor Google, you can find it. I think it was in the year 2013. Two people said, we are going to hack, get into one type of General Motors car, take control of it. And they showed that they can do it. This was 2013. Today, that is very common, that the threat is there. There was an example, you talked about a Tesla car. Two people had identical models of the Tesla car parked next to each other. Technically, they operate the car with either a mobile phone, Bluetooth technology, or you have a little card. The driver of one car, owner of one car got into the other car, the car started, then they drove away. The other person did the same, and then they realized after a while, this is not my car, because they were looking for something, it was not there. So there are those threats and vulnerabilities. How do we harden it? I don't have an answer. We need to work with cybersecurity experts to do that. And there are people who are looking for the slightest opening to take advantage of things. Let's move on. I believe I have talked about much of this. I want to get into data integration. These are the various types of data we've talked about. The last one, behavioral studies, Dr. Bharadwaj gave 2 examples from the naturalistic driving study that was conducted, Virginia Tech House did, and the 100-car study that was the predecessor. I didn't go into a whole lot of details. But the others, we've talked about it, the repair history, the vehicle registries, the National Vehicle Registry. If you are buying or selling a car there, buying a car, you can look up its history of has it been in a crash, not when did it go for oil change or so. But if it was ever in a crash, collision or repair, you can find that. So what does that have to do with safety? You can look at the condition of a car that somebody may say, oh, it's in pakka condition. But if it doesn't have all the safety features that were in original condition when you bought it from the OEM, may be different. But we can also use it to find out 2 identical vehicles operating in 2 different environments has a much worse maintenance or safety record than others. What is it? That must have to do either with the driver or the environment. So you can tease out inferences by looking at a collection of these data, not necessarily just an individual stream of data. I showed you some examples of how to tie data together from different fields, the unique record numbers. I also said we can use the geography, we can use the date and timestamp, the type of event that took place. There are many, many ways that we can use to stitch together what might be seemingly disparate data sets. So it's not easy, it's not simple. There are many, many challenges. How do we overcome the challenges? Technology is a big solution. If we are going to rely on labor, that's going to be much harder. As many of you have talked about, using emerging tools such as AI or ML. The last one, one of the last ones I have there, missing data. Many of the records do not have complete data. So how can you either fill in information to fill in the gaps, interpolate or extrapolate? Be careful when you're extrapolating. Once again, there are tools and techniques that are available. Or in some cases, you have to just discard certain data that don't make sense, that are extreme outliers, or you cannot justify why it is. The spatial joint deterministic linkages, we have done that. The deterministic linkage is the one what I showed you yesterday and today. Probabilistic is based upon more so when you do not have this discrete or definite fields, where you have more descriptive text entry. What is the probability that these are, or likelihood that, hey, you had a crash, somebody was injured, they were taken to a hospital, you have 2 different records. This crash occurred at such and such a time, it must have taken such and such a time to go there. The likelihood is it's the same case. I will not dwell more on this, just be aware that you need to work with people who are database experts if you go beyond a certain level, in terms of trying to tie data together. So the comment I have to my colleagues here, as they are developing and deploying the IRAD things, be mindful of not only what data you're capturing, how are you going to store it in what databases, and how would you link not only what you get from IRAD, but with the motor vehicle registration, with the driver's licenses, insurance, so on and so forth. Okay, I'm going to stop here. It is 5:15. I have 3 or 4 more slides, but I will pick this up early tomorrow. I'll just show you and these are case studies for implementation. I apologize that I'm not able to finish it, but I want to be. Don't know, Rahul. I don't have an answer. Rahul, right? Rahul,
Yes,
no?
yes.
I don't have an answer. I'm going to point you to my colleagues here.
Yes.
But as there are lots of tools, as I said, I'll show you tomorrow some examples of how companies are using technology to figure out if somebody is driving fatigued, driving
Yes.
drunk, using mobile phone,
Yes.
so on. I can tell you that how it is done in the US context.
Yes.
I do not have an answer for you in the Indian context.
Okay, sir. Thank you, sir.
You're welcome. Anybody online have any questions or comments? If not, let's,
No, sir.
yeah. Did somebody say anything online? No. Okay. If not, we will reconvene at 9:15 a.m. tomorrow. Professor Maurya, Dr. Bharadwaj, 9:15, right? And so we will do that at 9:15, and then later part of the morning, I will work to try to tie together. It's called a tutorial session, but it may be more or less a discussion on how we tie the bits and pieces that we have talked about over this last 4 days together. Thank you all very much. I wish you a good evening. All right.